A warm welcome to the VOH State Healthcare Conclave 2021 Maharashtra chapter. This is a truly august gathering of leading visionary minds in healthcare, and I am deeply privileged to be here. Let me take this opportunity to thank the leadership of Voice of Healthcare for organizing this noble, timely, and much needed initiative. And I would like to thank our beloved chairman, Dr. Naveen Nischal, and Dr. Mini Bodhanwala, organizing chairman of this event, and other dignitaries for his participation. They say, well begun is half the job done. Your esteemed presence and leadership passion has, in sense, already fulfilled the overarching goal of our mission, which is to align minds, unite hearts, break shackles, and take India's healthcare forward. India's healthcare is at the tipping point today, and big push from all of us can truly give it escape velocity. I invite your wholehearted participation and full involvement and look forward to some truly trailblazing ideas and thoughts. I thank you from the bottom of my heart for choosing to be part of this grand journey. Come, let us be the revolutionaries of who will transform the healthcare of our great and glorious nation, one state at a time. Once again, a warm welcome to VOH State Healthcare Conclave 2021 Maharashtra chapter. Thank you so much.
I'd like to request Chairman, Voice of Healthcare, Dr. Naveen Nischal, to give us Chairman's address.
Thank you very
Dr.
much.
Naveen.
Thank you very much, Mr. Sanjay Jha. Respected Chief Guest, Special Guest Kunal Kapoor, Bollywood actor and co-founder Cato, Dr. Mini Bodhanwala, CEO Wadia Hospital, Mumbai, and organizing chairman for VOH Health Conclave, Maharashtra, Sanjay Jha, co-founder Colmed, Afzal Kamalji, Chief Editor of Medgate Today magazine, Secretary General, Voice of Healthcare, my industry colleagues, delegates from Maharashtra and from rest of the India. On behalf of Voice of Healthcare, I, Dr. Naveen Nischal, Chairman of Voice of Healthcare, welcome you all for VOH State Health Conclave, Maharashtra. Before I start my address, I would like to thank all the frontline warriors, unsung heroes, those who are risking their lives along with their families. My sincere gratitude and a big salute to them. We are going through the biggest health crisis of our lifetime because of COVID-19. And now eruption of new strains is making the condition worse. Although we have been successful in fighting the disease with minimum possible damage, if we compare it with our Western counterpart, I mean, if I compare it with Europe or America. Similarly, Maharashtra is also going through a very tough time, and government of Maharashtra is fighting hard to contain the infection and new cases. I'm sure we will be successful at Maharashtra as well very soon. I would like to mention here that entire healthcare community is helping in the fight against corona. Maharashtra contribution in COVID fight is huge. Be it pharma industry based out of Maharashtra or hospitals or medtech device companies, they are not only helping Maharashtra but the entire country rather entire world itself. The idea of today's conclave is to create synergy and collaboration opportunities amongst healthcare stakeholders working in Maharashtra. We have got some of the finest healthcare leaders for the day long deliberation and discussion for the conclave. I'm sure we will be able to create some opportunities for everyone. But our endeavor is to keep working hard with these opportunities even after the conclave is over. Voice of Healthcare is a not for profit entity. We are working with several national and international organizations, helping them in uniting and collaborating. While we are doing a lot of activities to connect and co create innovations, products, knowledge exchange, academy at various levels, but we feel that there is still a huge gap in terms of connecting healthcare community. To conclude, I'm thankful to all the delegates, partners, speakers, special guests, our chief guest for being part of the occasion and gracing the conclave. Thank you very much. Thanks a lot.
I would like to welcome Dr. Mini Bodhanwala. She's organizing chairman, VOH State Health Conclave, Maharashtra. Dr. Mini Bodhanwala, over to you, please.
A very happy morning to you all. It's my pleasure and privilege to welcome you to the Voice of Healthcare State Healthcare Summit 2021 Maharashtra chapter. This is not just a noble but also a very timely initiative by the Voice of Healthcare. The eyes of the world today is on India. We have been on the forefront of progress for some time now. But COVID-19 truly brought about the destiny redefining potential of our indigenous technologies, innovative approaches, and resilience. The pandemic showed the world that when our backs are pushed to the wall and the similar roadmaps are blurred, the nation can respond with the unimaginable collective power as a united force and the chart its own route to the future. But it's equally important to hold on to this momentum, nor let it dissipate, even after the crisis is hopefully over. History will be watching closely to see if we can truly rise above our internal differences and consolidate on the good work and great gains achieved over the last 1 year. It's time to dissolve the silos, unlock our hidden synergies, and unleash the miracle of collaborative progress. Let us step forward to be counted amongst the pioneers and revolutionaries who took India's healthcare to the next level. Let us join hands, vision, talent, strength, and energies to look at our nation's healthcare through a holistic lens and factors in our regional diversities. And let us emerge with ideas and answers that will ensure the greatest common good, one state at a time, beginning with Maharashtra. Once again, I warmly welcome you to this confluence of minds. Let us create the change together. Thank you.
Thank you, Dr. Bini. It's an honor to have been asked to offer a vote of thanks on the occasion of State Health Conclave, Maharashtra. Maharashtra, we are facing the biggest challenge which COVID had presented, and we are really working hard to get out of that. So, folks, starting this conference with Maharashtra certainly makes sense. I would like to thank Dr. Mini Bodhanwala, organizing chairman, VOH State Health Conclave, Maharashtra, for your kind words. I'd like to thank Dr. Naveen Nischal, chairman, Voice of Healthcare, co-founder, Meadow, and Mr. Afzal Kamal, CEO, Medgate today. On behalf of my colleagues at Voice of Healthcare and me, I'd like to show my gratitude to all of the speakers for sharing their graceful words with us in today's meeting. Thanks, everyone.
So Hi, I have with me Kunal today, who's an actor and entrepreneur and has been running Keto for the last few years. So we have the privilege of having him across the table and chat with us today about how Keto has been working in the background for the last 8-9 years now, and impacting overall healthcare in sector in India. So welcome, Kunal. Thank you so much for your time and being here.
Thanks so much, man. Thank you.
Thanks.
So much.
So before we begin the formal chat, I think I've always been intrigued on how do you wear so many hats. Being an actor on one side, your film is up for release, I think, in the next month or so.
Next week, yeah.
Next week, yeah. Koi jaane na. So with that and managing a business, I always say मेरे से एक चीज नहीं होती. How are you able to manage so many hats?
I don't know. I mean, I don't think about it like that. I don't think about it as doing multiple things. I think it just comes down to what you enjoy. And I actually enjoy entrepreneurship as much as I enjoy movies. People believe that entrepreneurship and movies are completely diametrically opposite, which they are in some ways. But I feel like the core of both of them is very similar, which is creativity. Obviously, you need creativity to be in the movies and make a movie. But I think you also have to be very creative if you're an entrepreneur that's looking to disrupt something. The only way that you can do that is by being creative. So I think the core of both of them is creativity, and I think that is something that I enjoy a lot.
And what will be your secret sauce? What will be the secret sauce that will make it easy for you to be able to do all of that together?
I think it's just about like I'm saying, is that when you're enjoying something that you're doing, you're just present and you're in the moment. I think as long as you're present and in the moment, then you can focus on it completely. So when I'm moving, when I'm shooting a movie, that's all I'm thinking about is the next shot and being there and being in that moment. And when I'm interacting with you or I'm working to build the business of Keto, that's all I'm thinking about. So I think that's really important, is to absorb yourself in whatever you're doing. And I think being in the moment, we talk about it very often, but I think really implementing that is really important.
So compartmentalization of sorts, right? With your time, with your
complete focus, I think, complete immersion. I think that's important.
Wonderful. So please help us walk through how did Keto happen? What was that germ of the idea?
Well, Keto was actually was a very simple idea. Was I came across so many people that needed help, and I came across so many people that could help, and I often found that these people were not coming together. I had lots of friends that wanted to do something, and they were like, "How do we go about doing something? Is it going to go to the right place or not?" And I was working in the social space as well. I'd worked with a number of NGOs. And I found that these were challenges that the NGOs had, is that how do you reach out to new donors? How do you raise more money? So I was like, on one hand, we have people that can help, and on one hand, people that need helping, and they're not coming together. So how do you sort of use technology to build a bridge between these two? And the idea, of course, was that we spend so much time on our computers and smartphones. If we could sort of make giving very easy using technology, I felt like it could really sort of be powerful. So that's how Keto was born. It's a abbreviation for Key to Tomorrow, because the idea was that if we can democratize capital, which is controlled usually by very few people, and most people don't have access to this capital, then it could be something that really made a difference.
Wonderful. I imagine that over the last year, these dynamics would have had further tailwinds, right? With so much both need and people coming forward. How was your experience like over the last year?
Well, I think the only good thing that's come out of this pandemic is I see a lot of people wanting to contribute and making a difference. I think we've all been moved by the plight of people that have lesser than us, and how they struggle during a time like this. And I think everyone I know, people that have never made any sort of contribution, have gone ahead and started fundraisers to make sure that there's enough money for the migrant workers, there's enough food for the underprivileged, and I found that absolutely amazing. In fact, I have a friend of mine, his daughter is just 10 years old, and she was watching television with her dad, and she was watching this migrant crisis that was unfolding. And she said, "Look, I don't want to just sit and watch Dad. I want to do something." And she was 10. She's 10. And he called me up and he said, "Can she start a fundraiser?" And I said, "Yeah, sure, of course." So she started a fundraiser and she raised 14 lakhs.
Wow.
So you have the situation where somebody who's as young as 10 years old is sitting and watching the news and saying, "What's the point of just sitting and watching? What can I do to make a difference?" And I've seen a lot of that. How can I make a difference? And I think that's very, very sort of gratifying to see.
No, I can imagine. And I think children these days are far more woke, than I believe I ever was. I have a 7-year-old daughter, and yeah, the kind of questions she has, I think it's. Yeah. I couldn't have imagined me having those questions even now, let alone at 7 years. But yeah, so I think it's important to be able to give that voice, right? What part of what Ketu does also impact healthcare? Is that one of the key themes? How do you kind of look at it?
Yeah, it is. I mean, we started off by raising money for everything, which meant that entrepreneurship and movies and NGOs and also individual causes. But over the years, we've realized that our focus really has been medical, because that's the area that is most underserved. That's the area. I mean, we live in a country where it's estimated that 50 million people have been pushed into poverty only because they can't pay their medical bills. And most people don't even have access to basic healthcare. So our idea is that how do we make the whole medical system a lot more affordable for people, and how do we make capital accessible for people? And to give you an example, I mean, just a week back, me and my co-founder were going to meet different hospitals, and I had these two very interesting conversations at two different hospitals. One of the doctors told me that 40% of their BMT cases now are possible only because of crowdfunding. And she said that if there wasn't crowdfunding, these BMT patients would have not had the funds to be able to get treated. And then at the other hospital that we went to, the chairman was telling me that as recently as 3 years back, 5% of their social giving that they had in the hospital for patients was through crowdfunding. But now that figures as high as 65%. So I think that's the sort of impact that crowdfunding is making. And which is why medical really is our focus. And I think we've only just begun, because we are now mainly in the urban centers, and we've just started moving into the tier 2 cities. But I think unless we get to the smallest of towns and villages where people really sort of need that money, I think we are really far away from where we want to be. So our aim really is that how do we scale down to like the smallest of villages and make sure that each and every one that needs that help is getting the help that they need.
Yeah, well, I think that's a very noble thought. But what goes behind it? What goes in making that happen for a new city, for a new village, for a new town?
Well, there is, of course, a lot of resources that go into making that happen. Of course. But fortunately, over the years, we've had a lot of learnings which we've incorporated into what we're doing. We've also built a very solid team of people that have do outreach programs. We've also built partnerships with the hospitals. We've also learned how to put these campaigns out there. See, because most of the people that are raising money on this platform are people that firstly don't have access to insurance. They're people that in all probability will take a loan that they can't repay, will sell their land and gold, and so that they can do this medical treatment. And so obviously these are people that don't have a social network of their own. It's not like they can reach out to friends and family and people that they don't know on social media or through WhatsApp, because their circle in itself can't fund them. So what's really important is how do you use things like AI and data and cross-platform marketing to help these people. So I think all these learnings that we have will be very, very important as we start moving into, like I said, the smaller towns and villages now.
No, absolutely. And I wonder if, how genuine these cases are is also one of an important filters and I would say background checks that you would do, because I think if I look around myself, one of the biggest worries is कि यार ये लग तो रहा है ठीक है, but क्या है सही में is this a person who really is in need,
Correct. So how we sort of filter that is that most of the patients that are on the platform are, the money is actually going directly to the hospital. So we get in touch with the hospital, the bills, then the treatment that this person is going to undergo comes to us, which is what we put up on the platform. And the money then goes to the hospital. So it's not like the money is going to the individual's account and then this individual can use the money for anything else that they want to do, right? That's one of the mechanisms that we follow. The other, of course, is that people that can reach out to other people to raise money. These are people that, for the first network that you reach out to is your friends and family.
Yeah.
So it's very unlikely that you would reach out to your friends and family and they wouldn't know that, look, you're not in need. Or that you would reach out to friends and family and, for something that you actually don't need and you'll be like lying about it. So that's a sort of mechanism that gets built into it, which has prevented any sort of fraud that could happen on Keto.
Yeah. I remember, we were doing for some group financing. They use something very similar, which is your social capital, right? So like there's a group who's coming together and the loan is actually going to the group. So if one person defaults, the others have to pay, and that pressure itself kind of, and we underestimate the, I would say, the power of social validation somewhere.
Right. And also, I mean, anyways, I think there's it's changing rapidly, but there is still a sense of embarrassment about asking somebody for money. You know what I mean? Because you need to put it out there and you need everybody to know that, look, I'm in need of money. So in that case, for you to actually put out a fundraiser that is fake or false is very, very unlikely, because you're actually reaching out to people and your friends, your family, your networks of people to ask them for money,
Yeah. And is that a mandate before you can pick that up and market it as the platform?
So, we work on two models. One is, like I said, there's a lot of people that don't have access to networks. So in that case, we take the whole thing, we set it all up for them, we market for them. Most of those cases, the money goes directly to the hospital. The ones where you have to raise yourself is the ones where we feel like people have their networks and don't need this help from us. They are the ones that can start the campaign on their own on the platform. And they are the ones that can reach out to people from the platform, can reach out to their friends and family from the platform saying, I've started a campaign. Now, what happens is that usually all the money that you raise in that sort of campaign comes from your own network or the second and third network. Strangers usually don't get involved in, because you're not reaching out to strangers, you're only reaching out to your own network. So I think that's a mechanism that, sort of ensures that the chances of fraud are very, very minuscule.
Yeah. No, I can totally second that, because like I was telling you earlier, we had our own experience and engagement with Keto as a platform. This is in the very early days of COVID, when as Meadow and Meadow Foundation, we were actually giving out free tests, COVID tests, to people who were in need. And at that point, the test was starting at like $4,500-5,000 a pop, right? Which was way beyond, I would say, means of most people at the time. So we quite quickly were able to start the campaign on Keto, first for our own folks who wanted to give, and then I think we got a very prompt response and very good support from the marketing team there, which is why the questions, because I think I come to you as a happy user engagement from the platform. So kudos to you and the team. I think that you're really pulling off something which is fantastic.
Thank you.
Great. So, segueing to what you also briefly mentioned, right? Using technical advancements, using AI, using cross-platform to bring more impact to healthcare as a sector. How has your experience around that been? What are the big things that you've been doing around technology to make this happen? We'd love to hear about that.
See, I think the big thing, of course, is like I said, using right now for us is obviously using AI to sort of understand what sort of people will help this cause, who can we reach out to help this cause, how do we sort of reduce and make minimal the cost of reaching out to people. So I think has been a really important part of the sort of technology that we've been using on a platform like Keto. Going forward, we're also building a lot of apps to increase the engagement. I think that's really important, the engagement and education, because I feel like the more there's engagement and education, the less the chances of people falling sick is. I know it sounds very simplistic. It's not as simple as I'm saying, but I just believe that, when somebody is educated and constantly monitoring things and is engaged with other people that are, going through similar situation, the need for medical intervention becomes slightly lesser. So we are working on a bunch of apps which we're going to launch soon, which are in patient engagement and education.
And this is going to be like for the people or who are coming through the Keto platform, or in general available?
No, it's going to be for general awareness. Yeah.
Understood. Because I think what is also important is, and I think it's especially true in India, on when you are seeking the care, right? And I think that forms a very, very important part. In fact, I was looking at a metric that in India we lose 2 million people every year just because they are not able to get the right quality care at the right time. And one part of it is, of course, access and people not having access to a hospital, but that's not the largest part. The largest part is actually coming from the fact that people delay care because of adverse mindsets towards doctors and these facilities.
Correct.
To when they should have actually gotten the care. And the metric that I always used to demonstrate that is 70% of cancer cases in our country are actually detected at terminal stage, which is more than double that of the developed world and the developed country. So I think
I'm losing you a little. There's a little problem with the network, I think.
Sorry. Can you hear me now?
It's better now, yeah.
Okay, wonderful. So what I was saying was that the biggest drop is actually at the stage. A stitch in time saves 9 kind of thing.
Correct.
Right? That we're not able to get the right care at the right time, and thereby expanding the problem. And 70% of the cancer cases.
Correct. I mean, even at Keto, what we've been trying to do is, like I said, is that we live in a country where people first tap into insurance. If you don't have insurance, which a lot of people don't, then you start borrowing from friends and family. Then you start taking a loan. Then you start selling property and jewelry. We want to come in a place where once, if you don't have insurance or you've exhausted your insurance, you can turn to us. And that's taken us a very, very long time to get to because of the education that was required. When we started off, very few people even knew that something like crowdfunding exists. Not only the people that were giving, but also the people that could start a campaign. There was a lot of resistance to that. So it's taken us a while to get here. And which is why, like you're saying, is education and a stitch in time is a very, very sort of important part of, the entire healthcare ecosystem.
Correct. No, absolutely. And how are the other stakeholders taking it? I mean, I know you spoke about talking to hospitals, but I'm sure there's TPA insurers, hospitals, providers, everybody that we would be engaging with. What's their reaction?
I think hospitals now have really started realizing the power of crowdfunding. Because now hospitals have started seeing that there's a lot of patients that actually were not getting treated because they couldn't afford it. So when that happens now, when you have a patient that you feel as a hospital will not be able to afford this treatment or surgery or whatever they're going through, the hospital just puts them through to us. And then, we actually we try to make sure that they raise the amount of money that they need. So it's actually a great situation for the hospital as well, because you have a patient that would have otherwise not been treated. who's getting treated because of crowdfunding. I think, like I'm saying, it's a win-win sort of situation for everybody involved. There's somebody that is giving you money which you don't have to return, so it's not like you have this loan on your head which you have to repay after a couple of months or years. So I feel like a win-win situation for everybody that is involved in this ecosystem.
No, absolutely. I fully agree with that, and all power to you and Keto. So to make healthcare more available, accessible, I think we're all running with the same vision, and we're all rooting for you. Thank you so much for your time. And it was a pleasure to have you.
Man. Take care. Thank you. Thanks.
Thank you.
A very good day, everyone. And we are reaching out virtually to all of you in this current time. Certainly not ideal, given the quality, the seniority, and the experience of the panelists that I have today with me. Let me first start with introductions, and then probably we'll get to this very, very relevant topic. Every healthcare provider, every patient, and every healthcare technology and digital company has been talking about, which is really how telehealth, remote medicine, remote teleradiology, everything with respect to how technology has been playing a role in changing the way healthcare stakeholders have been interacting with each other. So, dear all, my name is Amit Mukim, based in Mumbai, and currently I'm the general manager of a company we call IQVIA. We are a global healthcare research, information, and healthcare analytics organization. We believe in the power of human data science and work closely with life sciences companies, payers, providers, governments across the world to bring in insights, both clinical and non-clinical, into the forefront of healthcare. It's a pleasure to be here with all of you. And I would now hand over to my esteemed fellow panelists to introduce themselves. So, Dr. Sujit, maybe we could start with you, sir.
Sure. Thank you very much. I'm privileged to be here amongst all my colleagues who are extremely well informed on these matters. I represent the Dr. Ali Shirindani Hospital at Y in Mumbai, and we are a dedicated COVID hospital. And today we are in the midst of a pandemic, and we've got the second wave hitting us. So the concept of telemedicine, teleradiology, and so forth, and so on and so forth, is extremely relevant for things for today. So therefore, with this brief, I shall request you to introduce the other panelists. I've introduced myself. Thank you.
Thank you so much, Dr. Sujit, and really appreciate you taking your time to be here. Over to Dr. Santosh.
Yeah, good morning, everyone, and thanks, Amit and Voice of Healthcare, for having me as part of this panel. So I'm Dr. Santosh Shetty. I'm the Executive Director and CEO at CONCLAVE Ambani Hospital. And basically, I'm a doctor by training, but hospital operations is my passion. For the last 22 years, been part of running hospitals. And the last year and a half truly has been, for all of us, amongst the most challenging times in healthcare. And as Sujit rightly mentioned, I mean, these COVID times have truly brought our management skills to the focus and helped us to cope up with some of the most difficult challenges that we've ever seen. And telemedicine, teleradiology, and digital health truly is something that is here for the years to come. And this pandemic has only accelerated the adoption of that. And I look forward to interacting with all of my colleagues as part of this panel. Thank you.
Thank you so much, Dr. Santosh. Over to you, Satish.
Yeah, hi. Good morning, everybody. Thank you, Amit, for inviting us. Thank you, Voice of Healthcare, for inviting Medivadi. So a quick background about me is I did my engineering. I'm actually an engineer. I graduated from IIT Madras. After IIT, went and worked with Philips Healthcare. So my introduction to healthcare happened at Philips. I was in the design of cath lab machines. I was based out of Pune initially, and then we had a plant in Chakan. So that's how I met a lot of hospitals. All of the hospitals that we have here, I personally met all of them, and the doctors at the cardiologists at all of these hospitals like 5-7 years ago. So that's also my introduction to healthcare, and spent a lot of time with doctors, hospitals, patients, operation theaters. And after that, left Philips to start a digital healthcare platform that makes sure that enables high quality healthcare and ensures that that's accessible to people across the country. So today, MediBuddy is a end-to-end digital healthcare platform. Patients can come do a video consultation with a doctor, also book appointments and go to the hospital, but also get their medicines delivered to your home, get your lab test done, and all the way you can actually get admitted in a hospital, and that's called IPD. So all the way from a doctor consultation on video till getting admissions. And we are very happy that we've been able to help more than 35,000 patients daily now. So on a daily basis, people across the length and breadth of the country come and use MediBuddy to access good quality healthcare. And pandemic has sort of accelerated the digital adoption. And in a way, it's very, very critical for India, because in order to get both of them right, both the accessibility right and the affordability right, there has to be a right mix of both digital as well as offline assets. And happy to be on the panel, please.
Couldn't agree with you more. And Satish, I've known Satish for quite a few years. Satish, it's been a fantastic journey what you've built. Congratulations to you, and thank you for coming onto this panel, because I think we've got 4 top hospital leaders, and then we have you as an entrepreneur who will do the reality check for all of us. So thank you for being here. Over to you, Dr. Patil.
Thank you, Amit, and good morning, everybody. I am a radiologist by profession, so I have about 33 years of experience in radiology, including teleradiology. I am also the Director of Medical Services at Nanavati Super Specialty Hospital, which is a 450-bedded hospital. I have been working as a leader in medical administrative functions and clinical team expansion at Nanavati Hospital for the last 6 years. Last year has been very, very challenging for us. We treated about 5,000 patients with about 1,000 plus in ICUs, and we tried to adapt digital technology very, very quickly in terms of telemedicine, teleradiology, and sort of turning around with the wave dying down. And again, we are trying to turn around with wave coming up, quick moving from physical to digital, digital to hybrid. And I have been leading that function, of course, with my team of about 7 or 8 people. Thank you.
Thank you, Dr. Parker. And last but not least, over to you, Dr. Tarang.
Good morning, everyone. Thanks, Amit, and thanks to Voice of Healthcare for giving me the opportunity to be here with all of you. So I think everybody has already touched upon. COVID has indeed changed the fabric of life for everybody, and I think that it's the. But I think at the same time, it helped as an accelerator to move the digital health and move telemedicine ahead. What would have been achieved in the next 5 to 10 years, I think quite a few of in certain areas we have achieved it in less than a year today. I'm Dr. Tarang. I am the CEO of Sir H.M. Reliance Foundation Hospital. And our hospital, apart from being providing care to all our inpatients, also caters to lot many patients on outpatient basis in a very non-typical manner, the way normally other hospital services are aligned. COVID has been a tough year because we had 2 facilities. One was completely non-COVID and one was COVID. So I can, from the experience of both, just share that it's much easier to manage a COVID facility than to keep a hospital completely non-COVID. It really needs lots of testing, lots of compliance to PPEs, and there are a lot of SOPs which go into it. And I think at this point of time, the digital piece and the remote management really helped us a lot. with our small facility of 100 beds at Seven Hills and a few beds at RFH, we have been managed to take care of almost 2,500 patients as inpatients and almost 1,500 patients on our home quarantine platform. It's been a great success, and it's always been a passion for me as a surgeon, as an orthopedic surgeon, as an MBA in healthcare, who believes that it's a strategic model, the good operational delivery, and passion towards patient experience, as well as giving the best value add to the doctors that the hospital functions. And in such a situation, I think it's been really an experience to manage this. I think we've all gone through something very different, and all of us have different experiences. But to manage both these areas in different geographical locations, I think it would only be possible because of telemedicine and the platform that we have created both for at all junctures, whether it is within RFH or at Seven Hills or at home quarantine. In addition to the fact that we have been doing a lot of health checkups as well for people, because I think it's the well-being of the people which is taken a very back seat, which we realized after the second quarter last year. So a lot of teleconsultations, a lot of healthcare at home has taken place, and I think certain of those things definitely are here to stay if provided we give a platform to both the patient and the doctors that they are comfortable to use. So I look forward to a great discussion ahead and learning from all of you this morning. Thank you. Over to you, Amit.
Thank you, Dr. Tarang. And, I must share at this point, I do remember that, in this group, at least, you and Dr. Sujit have been at the front lines of amongst the few other leaders in Mumbai and Maharashtra in managing this pandemic. And I do remember that Seven Hills was one of the first facilities that came up, if I'm not mistaken, exactly a year ago. So congratulations on that. And thank you for taking time out to be here. I was realizing that, it's a year gone by, and many times it's easier to look backwards and do a post-mortem than predict forward. And there were so many predictions that were floating around, right, on technology, on what would happen and everything else. Let me start with, a more general question. And the way I thought was we could just have a conversation amongst us, given, the nature of this topic, and move the conversation forward. And the general question is, if I go back exactly a year, and as leaders who were looking at what to do with respect to getting the patient-clinician interaction going, with clinicians not wanting to come to hospitals, with patients not wanting to be there, how did you look at telehealth, and how has that journey been from 2020 to 2021? And it's open for this group, to start this conversation, please.
So if I can just shoot, the whole issue was not the consultants or the doctors not coming to the hospital. They were the professionals were all here, and they were absolutely frontline fighters. But the issue was that the patients were very frightened of coming to a hospital, and they were under the impression that if you go to a hospital, the environment is such that you will pick up COVID. So therefore reluctant to come to the hospital. And that's where, sort of teleconsultations helped. It was like a bridge. And the teleconsultations were on a variety of things. Like, for example, if there was a patient who wanted to know that, look, I've got fever, but I've not been out. Now, what could it be? So we would start with the fact that, look, it's imperative that you get a treatment, an investigation done which is linked to COVID. And why so? Because of the fact that you're not very familiar with masking, you're not very familiar with your hand sanitization, social distancing at this particular point in time. So somewhere you let your guard down. And if you let your guard down, then this is the only way that we could really find, what's wrong with you. And so that conversation starts exactly how we are conversing. You see, there's a panel of doctors who sit, and they advise the patient. So the patient feels very, very confident, that, okay, I'll come to the hospital, I'll get the testing done. And then after that, in a point in time, the government also said that you can even test them at their houses, but that was much later. But this is the initial, icebreaker, if I may say so. It was enormously helpful. And then, of course, my colleagues will add to it, but there is a long story, and there has been a great maturity which has come in as far as the teleconsultation is concerned. So if you're talking in terms of a hybrid model, yes, consultants today might advise a patient to come to the hospital after they've had this sort of meeting. Clinical evaluation is much better done if you touch a patient and you examine the patient. But nevertheless, this was the genesis. I mean, this is the start point. So I just thought that I would just move into the genesis, and then the rest of my colleagues could, add on or, differ from what I've said. Thank you.
So I'll take it forward from what Sujit mentioned. So pre-pandemic, we did have a telemedicine platform for online consults, but I would say the utilization was less than 1% of our total outpatient workload, because whether it is patients or whether it is doctors, I think both the sections were very wary of just doing a consult online, and they had the typical apprehensions. But COVID definitely changed behaviors on both sides. So whether it is patients who are very reluctant to come to hospital because of the fear of catching COVID, or doctors who are at the hospital but not really able to see patients, I think both sides, the mindset shifted, and from maybe less than 1% in the initial few months, actually 25 to 30% of our consults moved to our online consultation model. And in fact, the load was so much that the whole day sometimes we used to go with just these online consults. And what definitely helped was both aspects, which is the COVID consults as well as the non-COVID consults. So there was a segment of the population which had to decide whether they wanted to come to travel all the way for a surgery from outstation in view of the travel restrictions. So those were the ones who were very comfortable doing an online consult. There was another segment which was primarily looking at follow-ups, post-surgery or follow-up for chronic medical conditions like endocrine and some of those specialties. So they were again the ones which immediately moved very comfortably onto online consult. So what definitely helped is that this pandemic created an environment where both sides were forced, I would say, to change their mindset and to change their behaviors. And once they got accustomed to doing this online, I mean, both sides became very, very comfortable. And that is something, which is, I think, going to stay sustained for some time. So we moved away from physical consult to the phygital, which is the physical plus digital hybrid model. And even as the pandemic began to settle down a couple of months ago, we still had about 10 to 15% of our consults continuing to happen online. And I think that is where the number will continue to stay.
Yeah, so just to add to that point, I think as soon as when, I think at the same time last year is when we sort of had our lockdown being announced, and then everything actually went into a big challenge at like one fine day, right? So what happened after that is, from a customer point of view, there's a lot of anxiety. When you look from a patient point of view, there's a lot of anxiety because like Dr. Santosh rightly pointed, some of them are worried about COVID, but a lot of them are also worried about other health issues that they had and they could not reach out to a doctor. And if you remember, the whole of the first quarter or maybe towards the second quarter also, a lot of surgeries had to be pushed down. So a lot of them could not even come back to their planned surgeries or even go, and unless it is very, very critical, they could not go to the hospital. So there's a lot of anxiety from a, let's say, patient or a customer point of view, and but clearly reflected in the kind of demand for meeting the doctors. And kudos to all our doctors, because they were actually in the hospitals, but of course patients were unable to sort of travel. So one, the technology platforms really, really helped. And I saw three key changes now that we are like 1 year into the system. The key changes that I saw was primarily on three areas. One, customer behavior. So even before this, even though there were telehealth solutions available, adoption to them was primarily by smaller town people because of distance or geography as a problem. But as soon as COVID happened, a lot of digital healthcare actually enabled not just the small town people accessing the big city doctors, but also, let's say, even if you're in Bombay, even if you're like 10 kilometers from Hiranandani, but you still have to do a video call now in the process. So that's when the customer behavior actually really changed and improved. Two is, we had to frantically help a lot of doctors, a lot of hospitals, a lot of healthcare institutions to bring up the technology solutions. Though a lot of doctors are convenient and know how to use the technology, but they still needed a software, they needed a computer, they needed the right set of cameras. Though it might be operationally simple, but think in lockdown, you're trying to arrange computers across the country and the right systems and internet and all of them. So the key second point is doctors also like quickly adopted, and a lot of hospitals rolled out. Maybe Reliance and Hirandani would have already had all these solutions, but a lot of other hospitals actually really deployed them very fast. So the key change was doctors and hospitals sort of rose up to the occasion, adopted a lot of technologies and implemented them pretty fast, and also trained their doctors as well as lesser nurses to support in the transitions during that time. And the third key change that also happened was government came up with regulations as well as clarifications very, very fast. So I have been actually interacting, I think all of us would have been interacting with various forms of digital healthcare, telemedicine guidelines, regulations for the last, so I started the company 5 years ago and I've been working on that since 5 years. But the day lockdown was announced, I think in less than 3 weeks, we had the complete regulations up and running. So in a way, government has also been very, very supportive in bringing up, and they were very, very forthcoming in talking to a lot of doctors, a lot of people in the industry to understand what kind of regulations will support and enable this to happen. And in a way, we can look at it like a demonetization moment. The penetration of digital moved up significantly during that time, and the curve came down. But over the last 2 years since our demonetization, digital penetration has, for let's say fintech or financial payments, has grown significantly, which is what I believe will also happen. So we had a peak in online consultation. It came down a little. So now it's settling at 1%, one certain percentage, which means the baseline has shifted significantly. And going forward, you'll start seeing a gradual uptick in the number of consultations that's moving online. And that will be a right healthy mix of both, let's say, online and offline. And this is what I think we'll see in the coming years ahead of us. Yes.
I'll quickly add a couple of things. We had our digital platform which was underutilized. We were primarily using it for our CSR activity, talking to UP, etc. Two things quickly happened because of compulsion. One, a lot of our endocrinologists, nephrologists, doctors with chronic disorders who the patients were meeting on weekly basis or fortnightly basis quickly adopted this because that was easy. It was just adjusting medication or fine-tuning of what was already done. Two, we used it quite effectively for giving psychological support to patients who were admitted in COVID wards. So meeting doctors was impossible, meeting relatives was impossible. The relatives were sending the patients at the doorstep of the hospital and leaving them there. So a big psychological impact was happening initially for 6 months when the COVID admission started. So we used effectively our psychiatrists and psychologists as well as physiotherapists for chest physiotherapy, using digital platform to help these patients who were admitted from anything between 10 days to 35 days initially. So these two things we use quite effectively for chronic patients and patients admitted in the hospital.
So I think most of the points are the same things which have been covered. So just to add to it, I think apart from managing all our 100 beds at 7 Hills, which was completely done, all the specialist care was done through the remote platforms, through the help of so we had not only done the teleconsults, we also brought telemedicine part of it. So we integrated a lot of devices along with the consults. We also worked towards providing a full continuum of care to the patient. So for once we just thought, and I just felt that, okay, when I meet a doctor or I come to the hospital, do I only come to consult the doctor, or there are other areas also? So there are other areas involved, whereas you may want to get blood tests done, the doctors would want to see what vitals you have. So before the consults, we created a environment of complete continuum of care. So there were certain things like, for example, if the patient had a consult and had to have a blood test done before for the doctor to see and then give the view, then those all were also integrated into that whole piece. Then obviously we use a lot of devices so that the doctors are aware. So for example, if it's an endocrinology patient and the doctor wants to know the hormone levels, so we were providing kits to ensure that the patient herself or himself checks the blood sugar levels before speaking to the doctors for at least a week, and then have a effective way or do have a follow up in an effective manner. So I think telemedicine is a lot beyond teleconsults. It's much vast than teleconsults, than that we all of course teleconsult is the easiest part and the lowest hanging fruit of the telemedicine, the tree of telemedicine as I call it. So apart from using it for mental health, as we also heard, we used it for the mental well-being of our staff also. We used it for the mental well-being of our staff who was with the COVID patients, who was with the normal patients, because we had created for a normal running a non-COVID hospital, we have to create these bubbles where the staff is also staying in green zones for a lot many period of time and they shift over. So they are also staying for whether a period of a month or a month and a half away from their families. So there was a lot of interaction which was required to be done for them. And lastly, I think telemedicine played a boon to us to take care of our free and outreach patients. As we know, in Reliance Foundation Hospital, we have a very large outreach program that we do for people in the community, which is the slums and other areas of Mumbai. So we have stationary medical units, we have mobile medical units. So all we needed was to have our paramedical workers go with the whole digital platform to them and do whatever was required for them in the field, whether there were blood tests, whether they wanted consults to provide them, and then accordingly we used to provide them for medication, because I think the free work suffered a lot because all the patients who usually come for free services were suffering a lot. So we started this also as early as around May and June, and I think that also played a very important part towards the goodwill, and you really feel that you have done for the people who need the most and who have the least access to these. So I think that's way. So I think there were a lot of things we did: IP monitoring, we did home quarantine through the tele platform. We integrated the tele platform of consult and the medicine in our EMR, which was very important for us to do that. And we also did it for our staff, the trainings, and as well as their mental well-being. And last but not the least, as I said, to take care for the well-being of the patients who are earlier coming to our free OPDs or who are a part of our outreach clinics.
No, thank you, Dr. Tarang. And I think, the conversation around adoption largely consistent. It's so interesting to see the different use cases that came up. The next thread of conversation I'd like to start is, and Satish, maybe you can start with, your views, is features, right? And I'll tell you honestly, when I did my first teleconsultation exactly a year ago, I don't remember which platform I got on to, but there was a lot to be desired. The conversation didn't go well. We were logging in and out. Obviously, everything was getting adjusted. And I'm sure that you have gone through your journey in upgrading, adding features, listening to customer feedback. It'll be great if you can share some of what your learnings were on the technology front. And then I'll request the other leaders to give a very fair and candid critique, which will benefit the industry on what they think technology is offering and where they see the gaps.
Absolutely, absolutely. Yes, Amit. So I'll give some pointers around that one, and then I'll sort of talk about all angles to the story. So one was primarily on the technology and how technology has to be sort of robust. Let's call it that way. So now there are two parts to this, because suddenly a lot of this happened, and the only access was either a computer or a mobile phone, and then most of us are. Most of them had actually only, of course, customers or patients have only a mobile phone, so we have to build all of the solutions to match at the mobile phone capabilities. So an Android or an iOS, or if you have a computer at home or a laptop at home, you can sort of do that. So a lot of work had to be done just on getting the basic application running. And though we had done a lot of work at the back end earlier itself, but there was like significant demand that came in, and a lot of work had to be done on what is called a scaling for us. And broadly, we see generally also we see that video calls is what is more comfortable. And though audio calls can still be done, but that's pretty easy. But a video call is what we always wanted to enable, so that the customer or the patient can see the doctor can see the patient, and there's at least some amount of a human connection or human touch that is coming across. So that had a few issues, and there's always a lot of scheduling conflicts that came, but I would argue that most of these are the early teething issues that came in because the scaling on technology side had to happen, and doctors as well as the paramedics also had to get used to it. I keep saying paramedics because doctors are like very busy between multiple consultations, and a lot of paramedics have to sort of support them in enabling the consultations happen in a very seamless manner. And they also do between a few of them, they're doing online, and there are one or two patients offline, and they have to like sort of match all of this. So broadly on the technology, a lot of this got sorted in the first 2 months, I think, and by the time a lot of them were comfortable on both sides, right, including very small things like getting very stable internet connection, faster internet connections. All of that is also sorted. The second one is more about the experience of the consultation. Now, what you have to also understand is before COVID, a lot of departments were already using teleconsultations very effectively. It can be psychology, psychiatry, dermatology. All of them were actually already amenable in a very simple way, and a lot of the learnings had already come into our platform. But suddenly, as after COVID, every department had to start doing it. So there are always very nuances in every department, and how a doctor looks at it, what is he looking forward to, and what are the kind of reports that he wants. Because uploading an X-ray is a tough thing, because DICOM images are very, very difficult. Then you have to figure out how to make it on a camera and then upload that, because you're still getting a good quality image, but may not be as quality as a DICOM one that you would see. So department-specific changes had to be made in order to enable efficiency on both the doctor and the patient. And the last one I wanted to talk about was, so let's think like this, right? Medicine by itself is like a 2,000-year plus practice, right? Science that has been practiced. Now think, and a lot of these cues that doctors get is actually because they see you in person, and they see you walk in, they see you walk out, how you behave. All of this actually gives a lot of cues to the doctor. But suddenly when you moved all of this online, a lot of changes had to be done. And we have to give this technology platform some amount of time, right? All of them will actually get up to speed. So what has been learned over the last, let's say, 1,000 years of science is now like cramped into 1 year of technology. So I would say that that's why a lot of these small issues with it. But all of this also will get sorted in the coming years. And that's why we strongly interact with a lot of doctors across online, offline, and get a lot of these feedbacks and say, what else will give you the right kind of cues? And can we like 100% replace offline with online? No, we can't do that, right? We have to find the right midpoint, and that is essentially the key one. And at least are we able to also identify? We did a lot of work on identifying what is called as red alerts. If there are 3, 4, 5, 6 red alerts, immediately the consultation is clarified that, hey, this cannot be done online. You need to like immediately come and meet me in the physical world. So these are all called as SOPs, standard operating procedures, that we have built in every department. That also ensures that customer or the patient safety is taken care, and the doctor is also actually able to give the right advice. So these are some of the things that we saw as features and solutions that we see. Happy to hear from doctors from the, let's say, on the first-hand experience on all of these platforms.
So I'll just add to it. I completely agree with you that when you have to build a platform for telehealth or telemedicine, first of all, what is required is the stability, both at the user end. When I say user, I mean the patient end as well as the doctor's end. Second, it has to be very, very user friendly. And now this user again is both the patient as well as the doctor. I personally feel that all of us who have had the use of this, I think one of the biggest milestone which I say achieved is that the doctors got convinced to use this as a platform and break away from the traditional method of practicing the medicine. The utilization, as we have all heard, on telemedicine was like 1% or 2% or 8%, and suddenly we all saw as administrators that the utilization went up by, I mean, I don't know, by, I mean, it was almost 100% for us. There was a phase in April and May when it was completely closed, and we started tele health and tele consultation as early as I think mid of April last year. 15th April and onwards, I remember the first batch of OPD appointments were given, and initially, we were only getting it from all ends. The patients also, connectivity is not there. I cannot log in. We have our Geo Health platform where we do do all these consults. So we had to stabilize that platform, which was done at a very, very fast speed. Then obviously the platform had to be made user friendly, and then user is a person who has never used this way. So you had to literally assist the user, as in the doctor this side as well as the patient that side, that okay, now if you have to review the report, you have to go and click this button, so then the reports will be there. If you have to review the vitals of the patient real time right now, so this has to be done, and then a lot of integration was required. But ultimately what I personally feel is that the basic principles which the Institute of Medicine has given us to provide healthcare will always be required in tele health as well, the way it was done for the physical health. So it has to be safe, and as you rightly pointed out, you have to have your SOPs aligned, especially if it is the doctor, if it's a paramedic who is doing a consultation, that there are these red alert signs which have to be picked up, and that there has to be a clear demarcation that no, this is not possible, please come to the hospital now. Then it has to be effective. The patient should feel convinced that okay, it is worth me not going. It is, so it's all about how you convince the mindset of the patient that okay, telehealth or teleconsult or telemedicine is the solution. It is more effective and better than you traveling all the way to the hospital, exposing yourself not only to COVID. The way it will sustain in future is when they see a value add for it without COVID also. That okay, we can sustain on it. It's not always that we need to go to the hospital. So it has to be effective. Then in addition to that, it has to be patient centric. So patient should feel that I am the center of this whole thing. Everybody is trying to focus the whole uh, every continuum or every point around my care. So if I need to, okay, so how do we make it is we make it multidisciplinary. So at the point of time, suppose normally when we come to the OPD, the patient is referred, okay, at the internal medicine person has seen or said, okay, fine, you need a referral, you need to see a gastroenterologist. So it has to be all done with a patient centricity in mind, that it is not like, okay, if I have done my internal medicine consult, now GI consult will happen after 1 week. No. So there is a person who has to follow up the whole thing as a project and ensure that the patient feels that, oh, I am in a virtual hospital. So I'm just walking through the various rooms of a virtual hospital, and that is where I think the value lies. And also it has to be timely. So we cannot have appointments taken and then make the appointments wait for a long time, because it is very frustrating. As we can understand, at home the person is sitting and the doctor is not coming in front of the screen. In the hospital we are used to waiting for 10-15 minutes, we'll walk up to the washroom, we'll do something else. But there at home you don't know, oh, because if I move out and if the doctor comes and I don't see him, then what happens? And it has to be efficient. So when I say efficient, I personally feel that we are replacing an in-person's visit by a remote monitoring system. So as a result, we need to make the person feel, who is on the other hand, the patient, that it is something which saves your time, it saves your money or in travel, and it keeps you safe. And at the same time, the doctor also has to feel that fine, he also has to be in a model which will incentivize him the way it is done at the OPD level, because initially we thought we'll do it all pro bono, but that will not survive. If we have to make it a model, we have to make it a fair model. And finally, it has to be equitable healthcare. That means it has to be the same quality of care has to be provided to everybody who comes on that platform, irrespective of their paying capacities. So I think, yeah.
So, Dr. Tarang, before I hand it over to Dr. Sujit for his opinion, I'm going to put you on the spot, by no means, but I'm going to ask everybody this question. If you were to give a score, on 1 to 10, 1 being lowest and 10 being highest, on what your overall satisfaction with the user experience was last April and what that score is today, those two numbers, what would those two numbers be?
Okay, so last April when we started, I think, and I monitor patient feedback very frenetically for every service myself, because that's the only way an administrator knows what's going on the ground. So I think last year in April when we started, the feedback on a score of 0 to 10 was roughly between around 6 to 7 when we started. And now when when everybody has mastered the whole art, I think somewhere between 9 and 10 is something what people rate when they come. Because we have evolved over a period of time on connectivities, on devices, on the way we organize the whole continuum of care, and also at our place, even for after post-op, the patient of an orthopedic knee replacement, when he goes back home in a day's time, the entire physiotherapy is done online. So we have to really monitor, and people say it's much better than me staying in the hospital these days, and it's much better for us also. We have to cut the average length of stay in any case if the patient is stable. So,
Awesome.
so it was.
Yeah. Thank you, Dr. Tarang, for that. Over to you, Dr. Steve.
Yeah, well, initially when we started, we had a lot of bandwidth issues. The problem was that the visibility was not very good. I mean, it's like you and I today. We are so clear, but in the early days, there were bandwidth issues. There were also challenges with like you have somebody who comes with pain abdomen and they are pointing the right side of the stomach, and now you're stuck with whether you are going to call this patient cross because you don't know the difference between an intestinal colic, or is it an ileocecal problem, or is it acute appendicitis, or is it something else? So therefore, these were the challenges at that particular point in time. And also, very importantly, the challenge that we faced was the education. And the education was, while the doctor spoke with the patient would want to say that, should I come across? So we said, no, you don't need to, because we are talking to you and we will be able to sort this problem out. He said, अगर हो सके तो मैं आ ही जाता हूँ. We said, no, wait, we'll get this thing. So therefore, the patient education and winning their confidence was a challenge for us. The stability of the platform, as all of you have discussed, was something which was, a challenge. But now Tarang has got Geo, but we don't have Geo. We've not come to that platform. Of course, I will get to, and I'm sure Tarang
You can always get Geo.
Yeah, you will do it.
Geo international platform.
I'm sure you will do it for no cost, pro bono. Come on. We go back a long way. Come on, Tarang. I mean, for old friends, of course, I'm sure you'll do it.
Of course, anytime.
We'll get back to Geo. And the thing was, the challenge that we face right now is basically that the facility exists, but the fear of getting COVID in the hospital is much lower than before, and people are coming into the hospital now. You asked me this question. You said that you put me on a spot as what was your score from 1 to 10 yesteryear and today. Let me reverse it. When we started off, it was fantastic. I would give it 8 when we started off, because people were desperate to speak to doctors, and it went off very well. But today, I would say I'm at 5. And the reason why I'm at 5 is that the concept of medicine, while it's great to have connectivity, it's great to have distant medicine being addressed, there is always that yearning from the patient that I would like to be felt, touched. So the patient might earn coming to the hospital from the disease point of view, but they yearn to be examined by the doctor. So if I was at 8 yesterday, I'm at 5 at this particular point in time. So I thought that's something that I would like to share with you. I don't think the rest of the panelists may agree with me, but that's what I am seeing today. Thank you.
Yeah, just like to add to what Sujit, Tarang, and Siddharth also mentioned. See, at the end of the day, I think everyone now is expecting to replace or simulate the physical consultation with the digital one. I think that is what all of us are trying to work towards. So when we started, obviously, it started with basic hygiene issues such as scheduling and who will call the doctor. Will the doctor call the patient, or the patient will call the doctor? And what happens, like somebody said that the patient is waiting and doctor still not arrived. So we have our own app, which initial days, of course, now when you look at it in hindsight, it was a very rudimentary app because a lot of the things we were doing outside the app in terms of taking photographs of the prescription or getting reports emailed and things like that. So over the last 1 year, we've integrated a lot of these things into the app so that there is also a chat mechanism wherein if the doctor is getting delayed, he can push a message to the patient that, I'm getting delayed and I'll give you a call, say after 15 minutes, 20 minutes. So that kind of at least allays the apprehensions that the patient has. Similarly, in terms of ability to type in their prescriptions, put their favorites. So the whole experience, we've tried to improve both for the doctor as well as for the patient. In terms of satisfaction, obviously, it's like a moving goalpost. So patients who initially were okay with just seeing the face of the doctor today want multiple things to happen online. So that's a process of evolution that all of us will have to go through. And of course, going forward, if you have IoT-based devices, you have AI and you have wearables. So, the scope or potential of this is limitless. But at the same time, we need to know where to draw the boundary. We need to know when to call in the patient. And that's something that we have to take cognizance of. What it has opened up, of course, is a new segment of the population altogether. So we have lots of patients from outstation who used to, not really come to visit us, but now they have access to all our doctors. We have lots of patients from outside the country who are getting this video consults and teleconsults done on a regular basis. So it's opened up a new target segment altogether. So it's definitely helped in expanding our reach. But yeah, it's still some way to go before we can absolutely replicate the physical consult with an online one. Thank you.
I would just add 2 things to this. Touch and feel that Dr. Sujit talked about is very, very important. But it is important to certain specialties. The other specialties do not require touch and feel. Radiology, psychology, psychiatry, etc. What is also needed today is combining all the information about the patient. That's where we lack. I have worked in UK for a year and a half, and the information about the patient, given patient, that is available, whether they have visited 1 hospital, 10 hospitals or 20 hospitals, is available at a touch of a button. That increases the efficiency quite dramatically, number 1. 2, it reduces a lot of wastage. So if government along with startups like yours can work together, that would reduce a lot of wastage. 1, also it will make doctors' life very easy. If you have all the information about the patient in given go, a lot of time will be saved, efficiency and accuracy of treatment will increase. So that is the way forward. And of course, with AI coming in, importance of giving appointments using AI, somebody who requires it on a emergency basis versus semi-emergency basis versus chronic basis, can be adopted by AI and the human interface goes away from it. That's very, very important. Otherwise, it works on your introduction basis, how you can get away or pass by things. So that should be taken care of. So a lot of wastage will be saved, a lot of repeats will be saved. And something like a Aadhaar card, if you have health Aadhaar card, which is what government is working on, that would really save billions of dollars for us.
Yeah, and maybe to last points on that was actually just on what you've done finally is there's some phygital that has come in, some amount of physical is there, some amount of digital is there, and my numbers would be 6 to let's say 8.5. It's true, the goalpost keeps changing. So what was 9 yesterday become 7 now, and then it keeps varying. But the point to note here is the ideal scenario is if the doctor is able to touch every patient. But because of the size and scale of our country, as well as accessibility to good healthcare, we need to identify a right mixture, and that's right, maybe the digital mixture. And a lot of this will evolve very, very fast in the next 3 years' time. And that exactly will then solve a lot of anxiety that both customers or patients as well as doctors have. Yeah.
No, I was asking Dr. Parker for a score.
So my score for somebody who's staying quite away would be from 5 to 10. But somebody who is very easily available, does not require it, would be from say 5 to 6 or 6 to 7. So it will vary from patient to patient and doctor to doctor. So somebody like a big oncologist treating patients in Africa or Bangladesh, what is the need? It would be 10 on 10. For somebody who does not require or does not, for a patient also who is sitting in Bombay, the may not be too much. They have access to everything very quickly without digital help. Whereas patients remotely located who do not have access to super specialists, it would be 10 on 10. So there's no single answer to your question, I would say. But if I really have to give answer, it will be 6 to 8. Moving from 6 in April 2020 to 8 or 9 on March 21.
No, thank you, Dr. Parker. I know we are about 10 minutes remaining. I wanted to touch on two aspects from the group. One aspect, very interestingly, has led to this question that it is not an all or none situation. I think we are all clear 50 minutes into this webinar that this technology has indeed helped. It has helped create access, right? Satish, the numbers you're talking about, where 35,000 prescriptions and visits and consultations are being generated every day, just with your platform, gives us an indication that there is, a large number of people accessing this care, and the benefit of people who are not in cities are also doing that. What I want to touch upon, if the group can share, especially for people who are not on this audience, is your crystal ball gazing on the type of therapy areas and procedures and the type of remote related telemedicine. And now I'm broadening it beyond telehealth for 20 to 2025. And reason why I ask is we obviously saw the government put out certain guidelines. There's a lot of deliberation still going on those guidelines, right? And the remit of telemedicine is not just the teleconsultation, to Dr. Tarang's point. It could be devices, it could be medicine fulfillment, it could be even interactions between experts in different cities. So if we can probably discuss what do we feel in the next 4-5 years, the kind of therapy areas and the kind of population that will really benefit from this technology.
Let me get this one. You said crystal ball gazing, and I think that's quite unfair, because in Ahmedabad, a couple of years ago, they did angioplasty on a patient in one hospital and the doctor sitting in another hospital. So therefore, such technology is available, and it will propagate. So therefore, you're going to get new technology coming in by which you will get patients who are treated off-site. So therefore, if you are in a hospital which is robotic compliant, and I have the software and you have the software, then in that case, my cardiologist who's sitting, 50 kilometers, 100 kilometers, 150, 200 kilometers away, maybe a continent away, will still be able to treat you. So I think if you are calling, if the question really is in, the crystal ball, then in that case, I would say that this sort of option is absolutely open, and it's been proven in India and Ahmedabad, and it's already been done. So therefore, I feel that technology is headed with artificial intelligence in a direction where you could have transcontinental treatment. So therefore, if we have doctors who can do extraordinary good work through robotics, I'm sure guys in the US, depending upon the insurance, guys in the US would opt for an Indian surgeon, because we've got vast experience as far as surgical technology is concerned. So therefore, they would definitely opt for a surgeon from India. Look at transplants. Look at stereotactic surgeries. So therefore, all this can be done, and it will be done. So my crystal ball gaze is, if you want me to be a Nostradamus, well, then I am saying that this is where we are headed. So in the next 50 years, the world is going to shrink to such an extent that you will have people ringing up from Mayo Clinic to the Reliance Foundation Hospital, or to the Hirnandani Hospital, or to Nanavati Hospital, or to Kokilaben Hospital. He says, can you do this surgery for my patient? He said, of course we can. You guys can't, we can. So therefore, I think that's where we are headed, and that's where technology is headed. And please, let me tell you, I am not shooting, in the air. This is reality, and it's going to happen. Thank you.
So just to take on from Sujit, I think technology is going to be the big leveler in a resource-deprived country like India. So, where we have shortage of high-end doctors. So, to give you an example, we are already doing some bit of this kind of work. So, we have 3 radiation oncology centers in the interior of Maharashtra, in Akola, Sholapur, and Gondia. We set these up as part of our CSR initiative, and these were cities that even I had to look up on the map of Maharashtra, despite having lived in Mumbai all these years. And when we set these up, one of the challenges was, how do you get good radiation oncologists to go and work over there, especially when there is such a huge shortage of radiation oncologists. So what we've been able to do is, through telemedicine, all the treatment plans are actually being planned here in Kokilaben Ambani Hospital, but are being delivered there in Akola, Sholapur, and Gondia. And so the level of expertise that exists in our hospital here can be transferred to those locations. And I think that is where technology is going to play a very, very key role, as Sujit said, that we will be able to actually spread these expertise across 2 cities, 2 towns, which may not have access to this. And technology will be the big enabler in this whole process. That's my view.
Yeah, so some of the points that I had was, we'll also sort of look at it from the point of view of primary care, secondary care, and tertiary care. So like we all know that hospitals are generally very, very good at doing some part of secondary care and tertiary care, and that is when it becomes like really mandatory and really necessity for you to sort of land up in a hospital. So a lot of primary care, which also takes up the bulk of the consultations and the bulk of the healthcare load of the country, can actually happen sort of online. And as a transition from online to offline, whenever the doctor tells you clearly that, hey, this requires a physical examination, why don't you come and meet me? They would sort of go down, and then post-operative or post the second consultation, they'll again go back to sort of online. Now, if you want to sort of do crystal ball, we would say that next might be, let's say, 10 years from today, potentially like 70% of your consultations can happen online and 30% can happen offline. And think like banking sector, right? We all used to go to bank every day and come back, but today the number of times that we go to bank is like hardly any. Of course, it took a long time. It took like 20 years for the transition to happen. So potentially there'll be like a 70-30 sort of split that will happen. The reason is because healthcare is very human touch, right? You really need to feel it. They want to feel good about it. And a lot of this is you just feel good about it, right? The doctor touches you, and then so that's why it's going to be like 70 sort of 30. And a lot of this will also enable in different departments. Today might be it's amenable to a few. A lot of other departments and a lot of tools and technologies, like rightly pointed out by all our doctors, will also come up, where a lot of these machines and solutions can be a part of my mobile phone, and potentially I will have a few metrics that can be attached to them, and that could collect a lot of information and send it across. And all of this will happen for both big city, small city, and it also takes away the challenge that we face today, because like Dr. Santosh told, when I talked to a lot of very senior cardiologists and doctors, the difficulty was they could not just travel outside the top 10, 15, 20 cities. And it's very difficult to build infrastructure like schools for your kids and other amenities outside the top 20 cities suddenly in one day, right? So then a large cardiologist or super senior oncologist cannot just travel to a small town. But that problem will also get solved with these digital technologies. But I think very exciting times ahead of us in the medical science and patient care in the coming years and decades.
Okay, so I think on crystal ball, let's look at few stages and what will happen probably in 2040. So I think in the next 5 years or maybe much before that, all primary care can easily go on a telemedicine platform. As far as the outpatient OPDs are there, especially the first visit, even to specialists, can be easily done in most of the cases, most of the specialities on the teleconsult or telemedicine platform. Physiotherapy, rehab, I think 80 to 90% can easily migrate to the teleconsult platform. Probably supported by 1 or 2 home visits. And unless a person, yeah, of course, if you need sports training and all, then you definitely need the high-end equipments. But for general rehab and all, I think that can be easily moved there. Robotics, yes, but I personally feel that for surgeries, still we are at least 5 years. We'll take 5 years, because to even do robotic surgeries between 2 different entities, of course, in addition to the softwares at both ends, you will need the 5G to connect the two together. Otherwise, the surgeon sitting at the console in one hospital will not be able to do it at the other hospital. He can observe and guide people, but he'll not be doing it. So we need to understand what we want. We want people to guide us. That can be done today. And that can be done across the globe. But if we want somebody sitting in a place like RFH or KDA or Hiranandani Hospital or Nanavati or any of the hospital and doing a surgery in a remote area, just because both the sides are connected, then you need that connectivity. So that is very important for the success of surgical procedures. And we all know not everything can be done robotically. So that will still take time, and I think that will still require the setups of the hospitals. As far as diagnostics are concerned, again, I think this is something which can be easily moved out of the hospital. And as we've all experienced, I think the ICU care was the first hurdle that was crossed during COVID, when we established facilities where we did manage the tele ICUs. So I think ICU care, to some extent, if we create platforms or command centers, can definitely and provide solutions both ends, can definitely be moved in the next 5 years on a platform. Why I'm saying 5 years? Because when we do COVID, we look at COVID, but when we see ICU, our setup ICUs, it is multidisciplinary. To get the alignment of multidisciplinary sectors, that will take some time. So I think 50 to 60% of healthcare will move towards a tele platform coming 5 years. and it will be a different entity altogether. It will be a different, so like today when we say, oh, I am a 250 bedded hospital, I'm a 350, I'm a 600 bedded hospital. I think going forwards, the future of healthcare is not the bedded hospital, it is the served hospital. So you can be a 100-bedded hospital, but support 1 lakh people all across the country, and that will be the way the healthcare will move. And one last point from me, I think the focus 5 or 10 years from now will not be on healthcare, it will be on health. So telemedicine will very much play a very important role in ensuring that people are in the good shape of health. So that's what my crystal ball shows.
So well put, Dr. Tarang. Thank you. Dr. Patkar, over to you, and then we'll probably close this.
Yeah. I'll take less than a minute because we have crossed the time. So I'll take on from what Dr. Tarang said. Point of care will completely change. A point of care will not be beds in the hospital. It will be the technology and availability of technology at the home of patient. Especially for old age patients, they don't have to come to the hospital. Terminal patients, if they don't want ventilators, they can be treated at hospital. Oncology, radiology, I think everything except surgical departments can move to point of care. And rather than bedded hospitals, we'll have community being taken care of by a big hospital. Second thing that will probably happen is how we have adapted very quickly as a country, India, and the complete knowledge process outsourcing is happening to India, whether it is Europe or America. I think complete basic healthcare can move to India if we are prepared digitally. We have large resource of doctors, we have large resource of nurses. If they can use technology adequately and properly, we can be based off the basic healthcare across the globe. We can treat Asia, we can treat Africa sitting here because we are very, very cost effective. So I'm quite sure if the technology moves in the right directions and we as a country are prepared, we can control the way we are controlling software. We can control the entire healthcare, at least the primary and secondary care very, very effectively. And for that, collaboration between government and startups is very, very important. So complete focus can change from being bedded hospital to community care, and we can control continents across the world. Thank you.
So on this really positive note, I'd like to thank all of you for taking your time out on a weekday for this discussion. Voice of Healthcare, thank you for organizing this. I have no doubt that this discussion will be quite relevant and rich for both the healthcare stakeholders as well as Satish, entrepreneurs like yourselves who are out in the trenches building these businesses. So thank you, everyone, and have a great day.
Thank you. Thank you very much. Thank you.
Today with amazing guests to learn from. The session we have is on smarter, faster, connected, way forward for medtech segment. This event is organized by Voice of Healthcare. I'm co-founder of Collateral Medical, CallMed, and we are tech-enabled B2B medical device distribution company focusing on tier 2 and tier 3 of our country. I'm a graduate from IIT Kharagpur and MBA from INSEAD. Have worked in medtech industry for more than 20 years with companies like GE Healthcare US and Johnson & Johnson Medical India. If we look at India, India is among the top 20 global markets for medical devices. The market is expected to increase at above 30% CAGR to reach USD 50 billion in 2025. I remember this number being 5 billion a few years ago. So this is how we are going to become much, much, much bigger. The medical device sector in India comprises large multinationals, small and mid-sized manufacturers, and direct importers. India has almost 75 to 80% import dependency on medical devices. With exports at around USD 2 billion in 2019, it's expected to increase to a USD almost 10 billion in 2025. Pushing the Indian medical devices sector to become self-reliant or Atmanirbhar Bharat. The government of India, through its flagship Make in India initiative, relied heavily on the Indian manufacturers to meet the surge demand of essential healthcare equipment. India is changing fast and getting connected. In the last 5 years, internet penetration has doubled in India from 27% in 2015 to almost 50% in 2020. This is most critical trend which is impacting all industries, and medtech will be no exception. Entries of global giants like Amazon, Google, Apple shows that the focus on this entire world has increased very much on the medtech segment. On that note, I would like to bring in our panel here. I would like panelists to give their brief introduction. We have the luxury of having 3 Indian manufacturers here. We have done really well in building their businesses in India, and a person representing Niti Aayog. So this is for all of you. We would request Gaurav to initiate.
Thank you very much for the opening, Sanjay. At the outset, I would like to congratulate the organizers of this chat show, VOH. I'd also like to thank Sanjay for moderating this session. So my name is Gaurav Agrawal. I'm the Managing Director of IITPL. We are a cath lab manufacturing company based out of Bangalore. We were incepted in 2016, and in the last 4 years, we've gone on to become the fastest growing and the most awarded cath lab company of India. We were also the medical device company of the year by Department of Pharmaceutical last year. Also awarded the President's Award for Innovation, among many other awards such as Red Dot Award by the Swiss government and Good Design Award by the Japanese government. So I look forward to this very engaging and stimulating discussion we have. As Sanjay said, the luxury of having 3 manufacturers. Would love to hear the perspective on the digital economy and how it's impacting medtech. Thank you very much.
Thanks, Gaurav. Over to Urvashi, please.
Yeah, thank you for having me as part of this discussion. I work with the Niti Aayog, with the Vice Chairman, Dr. Rajiv Kumar, and also currently working on the whole COVID response with the chairperson of the National Task Force, Paul. And my background is in healthcare, life sciences, public health. I've worked in different capacities prior to joining the Niti Aayog, where I've been there over the last 5 years, working on a range of healthcare related policies, and obviously also looking at sectors like pharma. Thank you.
Thanks, Urvashi. Sumit, please.
Yeah, thanks, Sanjay. So I have had the opportunity to work across various parts of healthcare or various subsectors of healthcare. Started my career with Deloitte Consulting in the United States, and specifically worked with large provider groups like Kaiser Permanente. And then I did my MBA. We are both alums of the same institute. In fact, classmates, me and Sanjay. So I did my MBA from INSEAD. Post that, I joined Monitor Group in strategy consulting. Again, worked with large US foundations like Robert Wood Johnson Foundation on doing some work with them in the strategy arena. Post that, I went to the World Economic Forum, where I was managing their community in New York with regards to developing relationships with the private, public sector, academia, and the political arena to really bring a comprehensive outlook towards health and healthcare. And then I worked with Fortis Healthcare in Singapore and in India in specifically business development and strategy before joining Midmark India about 4.5 years ago as a managing director. We are India's largest manufacturer of medical furniture, I would say, in the organized segment, where it's highly fragmented, and we have also won numerous awards. We are pioneers, and in many of the products that we have been pioneered by us in India in the medical furniture space. And today we are proud that we are one of the few multinationals who manufacture in India. So we are completely Make in India, and Atmanirbhar Bharat is something which resonates very well with us. Thank you.
Great. Thanks, Sumit. And to the person who stays closest to my home, Avinav.
Thank you, Sanjay. So I'm representing Accurex. Accurex is one of the oldest companies in the diagnostic sector in India. And when Atmanirbhar Bharat was not even the in thing, we started manufacturing in 1984. And we have been the first manufacturer of the biochemistry enzymatic reagents in India. So we have over 35 years of experience in this field. I have been the managing director of the company since 2004. Since over 15 years, I've been now heading the company. Since I joined, we were a team of 70. Now we are a team of 170 and have grown the revenues 4.2 times what it was at that time. I'm also involved with the Association of Diagnostic Manufacturers of India, which we call as the voice of the Indian IVD in vitro diagnostics industry of India. We have more than 62 members. We cover 95% of the diagnostic industry in India. I'm the secretary of the association, and we represent our members towards the different government bodies like the CDSO, Department of Pharmaceuticals, the Ministry of Health, Niti Aayog, and we help in coming up with strategies and plans and goals that will help the industry go forward. I'm also associated with the AMED as the joint coordinator for the Western region since I'm based out of Mumbai. So this gives me also a little bit more access, knowledge, information to more wider things which are happening even outside my particular product segment as a overall what is happening in the diagnostics industry or the medical device industry. And it's interesting with the recent developments which we'll be covering. There's a lot of developments that have happened in our industry in the last 1 year. With that, over to you, Sanjay.
Thanks, Avinav. I have interacted with you multiple times. Like, very inspiring story you guys have, building something from scratch in India when these things didn't even exist here. So thank you, everyone. Coming to the main topic of Atmanirbhar, right? Self-reliant. When I moved back to India in almost 10, 12 years ago, it was a very different landscape. My dream was to come back to India. I used to do R&D in GE Healthcare. I wanted to come back to India and do R&D in India and realize wo to nahi hone wala. So then did my MBA, got into business side, and I moved on from there. So, but now the world has changed. The amazing companies like you guys have come up. So how have you been able to capitalize on the Atmanirbhar Bharat ecosystem? So if I look at how can medical companies create value products to especially further penetrate the T3, T4 cities of India, which is the heart of India. And this question is to all you three manufacturers. Okay, I'll start with Avinav, please.
Okay. So if you look at our industry, the diagnostics, it's heavily import dependent. And I personally believe that products manufactured in first world countries where first world wages are being paid cannot be sold in emerging or developing countries, because this is simple economics. You're paying wages at a very high rate, and you're selling the products to people who are being paid 1/4 of those wages. So definitely these products have to be made in India to make it affordable to the population of the country. And I've seen it personally that when we start manufacturing these products, the pricing of the products comes down significantly, more than 50%. So the way forward to increase the affordability and the access to tier 3, tier 4 towns is going to be through the manufacturing. It has to be manufacturing so that we make it affordable to the population in India going forward. So from 80% of import dependence on the instruments part, the diagnostic instruments. Reagents, we still have a lot of capacity in the country, but instruments, 80% is being imported. So that is somewhere where now we need to start focusing on manufacturing of that.
Okay, Gaurav, what's your take on this?
Yeah, so Abhinav brings a very interesting perspective, and I agree with a lot of what he said. Coming to my area of operation, which is coronary artery disease, I would just like to give a very quick perspective since we are discussing Atmanirbhar Bharat. There are about 460 cities in India with a population of more than 1 lakh. And this is as per 2011 consensus. That number is likely to have swollen to about 1,200 cities. So we're talking 1,200 cities, population of over 1 lakh. It is interesting to note that less than 200 of these cities have facility like a cath lab. A cath lab truly saves lives. You have a heart attack, you need a cath lab to save a life. There are medical treatments available, but 3/4 of the time patients are unable to make it. Now at IITPL, we've recognized that this is a huge gap area, and medical electronics, an area that we represent, constitutes nearly 65% of India's 42,000 crore import bill. So we are making a small contribution to make especially heart care more accessible and affordable to a larger segment of the society. In the last 2 years that we've been on the market, we've installed our cath labs in 60 cities. 8 of these cities did not have the facility of a cath lab. So in 8 of these cities, patients had to travel between 80 to 200 kilometers. Imagine a patient with heart attack having to travel 200 kilometers. A lot of them would not be able to make it. In my previous jobs, where I was associated with the interventional cardiology industry, this was a huge pain point. You would walk into cath labs and typically see villagers coming from far-flung places and sometimes collapsing at the gates of the hospitals. It's a heart-wrenching sight, honestly. We are happy that we're able to make our contribution. Having said that, since the topic of today is also connected and digital economy, we are not only making heart care more accessible, but we're also creating cath labs of the future, which are largely based on 3 principles of digitalization. First is interoperability. When you enter a operation theater or a cath lab, there are 10 to 15 different diagnostic or imaging modalities that are working. Interestingly, none of them talk to each other. You know, you have a ECG, you have TMT, you have echo, you have 2D echocardiography, you have fractional flow reserve machines, intravascular ultrasound, and all of these are standalone diagnostic modalities. We are trying to create an integrated network of diagnostic modalities where healthcare and diagnosis is seamless, making clinical outcomes more precise and more reliable. The second area where we are investing a lot of time, money, and effort is in artificial intelligence. So artificial intelligence, basically, as we know, is now creating human simulators to predict, to suggest, and also to improve and make clinical outcomes more precise. So, for example, you can create a large archive of cases done in the past, and artificial intelligence could suggest a treatment approach, for example, for a tumor or for a lesion in your coronary arteries. There is a lot of work that we are doing with some of the largest universities in India and outside India to address that challenge. The third area which we are working on is basically remote sensing and diagnosis. Today, imagine we have a cath lab which is 300, 400 kilometers from the nearest airport, and it's a life-saving equipment. What if there's a breakdown and there is a critical patient on the table? We are developing technologies of the future where all the parts, most parts, moving parts, electrical parts, X-ray parts and mechanical parts generate a lot of data which can be stored on a remote diagnostic server, and most of the breakdown or service calls can be attended remotely. So I just wanted to say that we are doing our bit not only to make India Atmanirbhar, but also create Atmasamman.
Really good work, Gaurav. Sumit, what's your take on this?
So I think that Sanjay, the growth which has come in terms of the medical device or medtech industry over the years is just at the rate of inflation. So it's still a pipe dream to get to that 50 billion number which is there. My take is that to be Atmanirbhar, there's a lot that needs to be done in India, and the reality is that yes, we are all making progress. We are manufacturing proudly in India, but I don't think that we can grow the market beyond the rate of inflation until unless there are some major changes that have to be made. And I think the government has to really step in this, because if we look at some of the PLI schemes that have been coming through for, say, smartphones, for the auto industry, the allocations are so large, and they have really allowed for companies to invest and reap those benefits. But when we look at the medtech industry, I don't think that is happening just as yet, because the scheme is, you have to do an incremental investment. On that incremental investment, you will, whatever incremental profit you make, then the 5% of that you'll get as an incentive, which is minuscule, if you ask me. I mean, the reality is that there are companies like Ireland and Singapore who have really, really taken a step forward. So if we are growing at the rate of inflation, does that really make any sense? I mean, to be honest, not, because the inflation rate in India, yeah, in the books could be 8%, but reality is it's about 15%, and that's what we may be growing at in the medtech industry. So I think now, when it comes to Atmanirbhar in our in my company, the duty structures are so low when it comes to custom duties that the Chinese imports still happen. The market is still being flooded. So while we are doing our bit to be Atmanirbhar, what is the government doing in terms of really discouraging imports to come in and flood the market? So I think it's still far from reality. We have been for 70 years working in India and trying to work and get the costs lower, because that's the need of the tier 3 and 4 cities of India. We continue to do that. We are modifying our products, doing frugal innovation, but still to have a healthy bottom line and to propel the innovation factor which is needed in medtech, it's far from where we are today, and it will take a lot of effort and lot of public-private partnership with lots of incentives and schemes that need to come, which will propel us in that direction. That's my take.
So thanks, Sumit. And I did see Avinav smiling when you were talking about import duty. So
similar story.
Yes. So this I've heard from quite a few other manufacturers as well. So a question for Urvashi, and we are very lucky that Urvashi is here because she can help us understand a few things from the government initiatives. And I did see government trying to do quite a few things. And so Urvashi, what would be the impact of government schemes like NDHM, PLI in driving medtech innovation? What is the think tank here? If you could please talk about that.
Right. So, yeah, so I think it's firstly very important, when we talk of policy, to see the sort of context that we're operating in, and the sheer, scale and depth of challenges, as well as now opportunities, because the post-COVID era also brings a host of opportunities with it in terms of widespread adoption of technology, digitalization, etc. So I think we need to first see that context, because, policy changes and impact don't always happen overnight. It's a fairly long-term process. So we must get that context right when we're looking at it. So I think if we look at the medtech space in India, and a lot of this has been pointed out, but it's not just import dependency. We have various other issues that obviously we need to tackle. We are also at the lower tech end when we look at most of the domestic manufacturers, and the higher end devices are mostly coming in from the multinational companies who have extensive service networks here. Most of the Indian manufacturers are also still MSMEs. And so there is also, of course, an issue there of scale and also turnover. So that is also something that we need to be looking at here. And when we look at the challenges for this sector, there's of course a whole host of challenges. There's cost. There's also the infrastructure, the supply chain logistics, the cost of finance and power, all those kinds of things, and also research and development. So we are looking at a very broad gamut of issues to be addressed, first of all. And I think that is something which is important to acknowledge. And a lot of these have been around for years. These are not some things which have been around for just a short span of time. Now, in the medtech space, in the policy space, we started from a truly fairly low base. For the longest time, even in the regulation, in the policy space, med devices were not even seen as distinct from pharma. There was one big category in which everything was lumped. So we had to start right from that level, where we had to bring in separate recognition, firstly, for the medical devices rules. So, we've brought in certain categories. We've brought in the National Essential Diagnostics list. So these are all steps forward. These are not perfect. A lot more needs to be done. But at least they are steps forward from where we started. We started at a very low base, and that's important to point out here. Of course, the PLI schemes, again, there's always room to do more. And I think that's always the case in policy, that you can always bring in more. The medical devices parks that, we're looking at, so very much like the Andhra Pradesh MedTech zone, we have some good, experiences coming out of that. So we're also trying to look at that in various other states, in Andhra Pradesh, in Telangana, Tamil Nadu, Kerala, etc. So a lot of that effort is also on at this point. And we're also looking at the possibility of research-linked incentive schemes. So not just the PLI schemes, but we're also looking at how do we really bring in the cutting-edge research and development and innovation, and also move us more towards the higher tech end, as I said, rather than just remaining in sort of the class A and B space of devices as we, historically been in. How do we also move that up further? So we're also looking at the possibility of bringing in additional schemes here in research and on providing incentives for that. So I think there is a lot of action happening. I think, I wouldn't look at it with pessimism that, we haven't done enough. Rather, I would say that we have moved the needle forward considerably from where we've been. Is our work done? Absolutely not. We have a lot more to be done, but it can only happen through a public-private partnership mode. We cannot have this, this constant distrust between the government and the private sector, and I think it works both ways. So I think both sides will need to work together. Rather than always questioning or doubting one or the other, because that's not the way we can move forward, and we have such a huge gamut of challenges to address. So I think that's what I would say, very broadly speaking. Yes, there are a lot of other schemes. You mentioned the Digital Health Mission. There's also Ayushman Bharat. And I think a lot of these at some level do impact this whole space. So with the Digital Health Mission, we're obviously trying to, again, bring in the whole focus on digitization there, as well as use of technologies, as well as use of artificial intelligence, etc., within our healthcare ecosystem. But of course, it's important to remember that it has to be very usable and practical. Much of India doesn't live in just tier 1 cities. Most of India is not, going to hospitals like Apollo and Fortis. So whatever technologies we bring in, whatever we talk about, has to have the potential to eventually reach the last person out there. So I think that is something that we need to make feasible, even as we talk of all these big technologies and all these fancy terminologies. So I think that is something that we are looking at very, very carefully and very, very seriously at this point. And also Ayushman Bharat, we have a long way to go there as well. And I think this is again something that we cannot do without a partnership, between the public and the private sector. because we need to move it away. Not, we have a lot of focus on tier 1, tier 2. We also need to go to our tier 3, tier 4. How do we make it viable there? How do things work out that we actually provide services there at a costing which works for everybody and is ultimately also affordable for the people? So I think there are many issues that we are looking at and we are working on. But overall, I would say that a lot has been done. There's a lot of interest in this sector that I have seen just over the last few years. As I said, we've evolved from a fairly low baseline of how we used to look at the sector, even in the policy space or the regulatory space. So I think we need to keep moving forward, but it will only be through partnerships and through a greater trust between both the public and private sectors. So I think that is the way that we will have to use to move forward and to make use of the massive opportunities that I think the post-COVID era has created for this sector.
Well, thanks to Roshi. Thanks for bringing out quite a few interesting points there. This topic itself is a very long topic, so I would request people to move away from this and coming back to our connected topic. So one of the things we had been looking at is our most of the medtech companies had been capitalizing on is D2C and e-commerce opportunity to drive growth. Okay, at CONCLAVE we started this in 2012, and we built our India's first medical device focused e-commerce B2B company. Literally, we moved away from the e-commerce, so we start in place of e-commerce, we made it tech enabled, okay, which is a different form of perhaps e-commerce. Abhinav, I would like to, because you might have done some work in this area, I would like your take on this. How do you see this opportunity? Do you think it is going to pan out and become much more useful for you guys?
So I think for us, it's still in a very nascent stage. Our customers are still, serviced by the brick and mortar distributors, and overall, not only as Accurex, but overall as an industry, the e-commerce movement is negligible. I would say less than even 0.5%, which has moved online. I would see more e-commerce moving on to hospital purchases, I think, where there's larger value purchase. In our industry, the ticket size of purchase is smaller. So it's not moved online yet. So for the B2B part, B2C definitely.
So my 2 cents on this, Abhinav, what we have seen is the product which is close to the doctors, right? For example, stethoscopes, okay? Right. They fly online, okay? But where the payment has to come from somebody else, not from the doctor, right? From the perhaps a hospital budget or some other place, that's where the challenge comes in, okay? Yes, sorry, go ahead.
Yes. So the challenge comes in there, and also like you said, like the stethoscope, right? So the like when you're buying a big laboratory analyzer, the value is high. So then it'll definitely happen, but it's not happened yet. That's for sure. And the consumables require a cold chain, and there's a credit period involved. So once these issues are overcome, I think it'll move online, and it'll reach that tipping point where it'll just like suddenly go ahead, like what happened in other areas of technology like Ola, Uber, etc. Right? Suddenly it reached a tipping point and it just galloped ahead. So it'll happen anytime.
So interestingly, this is the area where we perhaps need to learn from the government. Okay, the work which is done at James and the way it's catching up, I've been very impressed with it. Urvashi, can you please tell us a little bit more about that? How do you see it becoming more and more important?
Yes, so I think GEM it was started very much with this in mind that we need to make the whole procurement process much more transparent. But eventually, it's there's also several other goals that it can actually meet and bring in greater standardization, especially as we are looking at certain schemes which are being implemented pan-India. Ayushman Bharat being the obvious example. It can bring in that sort of scale, so it can also drive down costs, and it can also make a lot of things affordable, and of course create that standardization, because that's a big issue, especially when we have to implement these pan-India schemes. So I think there's several objectives that we've now tried to bring, into this whole GEM concept. And of course, a lot of these need to be still evolved and worked upon. But that's sort of the broad idea. Now, the marketplace itself, as you said, yes. So, it had initially around 95 categories, which were listed on the platform. But actually, last year, we saw that another 146 in the medical category and 54 in the auxiliary category were added. So now there's actually over 200 such categories which are there on the platform. And actually during the COVID times, it was very, very useful, because a lot of the supplies, the sample collection kits, the thermometers, the cardiac monitors, even ICU beds, and also services, like temporary hospital and isolation facilities for asymptomatic and mild symptom patients, all of these were listed and could be accessed. So I think that is something. I think under the 146 new categories that we added, I had checked this number some time ago, but we had at least over 10,000 sellers which had been displayed, over 30,000 different products on the website. So it worked pretty well during this whole COVID effort as well. I think it really helped us, because that was a time when we were looking to do large scale procurements, very short span of time, and we had very specific needs. So the portal, we could actually fix shorter duration bids with shorter delivery periods for certain specific categories. We also provided features to shorten the procurement cycle for certain items. So I think it does have a lot of potential. It has also delivered in many cases. But as I said, since we've brought in a lot of other objectives that we'd like it to fulfill in terms of truly helping us with standardization, truly helping us to drive costs down, in addition to, of course, the openness and the transparency factors. So I think we should definitely keep working on this and on this, because as a platform, it certainly has great potential.
Thanks, Urvashi. So we talked about the trading side of the business. Now, for a product to be really sold, and one of the challenges which we have seen in India in earlier days, the product quality. Typically, our quality haven't been that great historically. We have made some amazing changes lately. And I would request Sumit and Gaurav to comment on what are the best practices in product quality, efficacy, customer support, and data security, which is also a very, very important piece of medtech for the medtech players. In US, it is one of the very, very important part. In India also, it is going to become much more important in future. So Gaurav, would you please take the initially?
So you bring a very pertinent point, Sanjay. India is recognized as being a top-notch engineering talent pool for creating technologies. We are great at prototyping them. There are a lot of institutions of eminence that we have, some of whom I've had pleasure of working with. But prototyping to product is an entirely new journey, and sometimes the most tedious one. It's easy to create a prototype that works in a very controlled environment, but the real test of the pudding is when that product is put on a patient and it's delivering consistent outcomes day after day. So in my opinion, we are in a space, medical equipment. One of the design goals for us when we set out to build a cath lab, there were only three goals. First goal was to have the smallest footprint. That came across as a very strange goal for many people. They said, why do you want to build a small cath lab? I mean, cath labs are large, bulky animals. You creating something which has the smallest footprint. The second was to make it most radiation safe. We wanted to have the most radiation efficient cath lab, which is directly linked to patient and operator safety. And the third, interestingly, was to have the most aesthetically appealing piece of medical equipment that has been built in India. Now, the perception of quality not only has to do with factor, but also form. we provided a lot of emphasis on the form. We hired some of the best industrial designers in the world. And the product went on in its very first year to win the Red Dot Award, which is also called the Grammy of Industrial Design in Switzerland. We also went on to win the most coveted Good Design Award by the Ministry of Commerce, Japan. And my message, honestly, to people in the medical electronics equipment space is that a lot of times you may not get rewarded incrementally for the form factor, but it goes a long way in creating perception of very high quality. The second part that you touched upon is customer service. You know, the reason why we've been so successful, we are now the third largest selling cath lab in the country in less than 2 years, is because across 38 parameters of customer satisfaction, we have consistently ranked above 88%. So our customers bring us customers, and that is another area which gets impacted by your quality. If you don't get it right the first time, you'll have more breakdowns, you'll have more complaints, and that also, in the long run, creates a perception of poor quality. So that's all.
And what about data security? Yeah, what about data security? What do you think about that?
So data security in our field is extremely important. Patient confidentiality of medical records is something that we take extremely seriously. So we have medical grade encryption in all our data records. Our acquisition systems, our data workstations are completely 256-bit encrypted, and we ensure that data safety is at the top of all our software development. So any area which involves a patient record is treated with absolute discretion, and there is 256-bit encryption in that data.
Okay. Thanks, Gaurav. Sumit, what's your take on this? Sumit, you have to unmute, perhaps.
Sumit, you'd have to unmute.
Yeah, sorry, I couldn't hear the question. There is a network issue. I apologize.
Okay, so we are talking about what are the best practices in product quality, efficacy, customer support, and data security for the medtech players in this industry.
I think the key thing is for us, like I'll just use our example, is when we look at our customer base, I think the presence and getting that last mile connectivity, right, when we come to customer support is going to be key. And that's where we've invested quite a bit to connect to the tier 3 and tier 4 customers. And that requires frugal and constant innovation to be able to find a distributor network or go D2C, as you were elaborating earlier, Sanjay. So we are putting more teammates of ours in these geographies, because I believe that tier 1 and tier 2 cities in India are pretty much saturated when it comes to, I mean, there are replacement opportunities, but the real growth in India will be tier 3 and 4. And when it comes to data security, to be honest, we in our case, you know, in medical furniture, there's not much of that to be looked at, but we keep our whatever customer data secure, and that's something which we look at on a continual basis, that we have all the right standards which are followed, and we do a fair bit of exports as well. And in that case, you know, there are certain laws which are changing in Europe, because data security, again, for the patient and for the customer, is to be adhered to in a very, very different way, actually very stringent way, and that's something which we are adhering to. So to remain constantly updated on these policies which are framed by various governments is key. But I think in India, another thing which we need to do is look at the standards, right? I mean, NABH is one thing which has happened for hospitals. Similarly, for labs, there are more standards that have been devised. But again, more stringent standards have to be put in place, and I think adherence of hospitals still I see is not happening to even NABH level. And then today also people prefer to say that, okay, I'm JCI accredited, right? There's more pride in saying I'm JCI than NABH, because it's considered the first level of accreditation, but then people are aiming higher. So can we look at that? Even during COVID times, when there was a lot of procurement made by government and even the private sector, there was no even a simple class A device, or I should say equipment like hospital beds. They didn't adhere to any standards, right? There were plastic beds, corrugated boxes that were put in these places, steel, done up like a simple bed. So all that has to change as well. When I think of standards, and when I think of privacy and penetration into these new markets.
Thanks, Sumit. Yes, in COVID time, even I came across lots of bad quality product scenarios. But those are the things we need to learn from. We learn from how to take the next step forward. Coming back to, so one of the areas which we are talking about, connected, right? So how are new technology trends like Internet of Medical Things, AR, VR, etc., driving innovation and new product launches in healthcare? Avinav, what's your take on this? Abhinav, you're mute.
Abhinav, you're on mute.
Yes.
Sometimes it takes a pandemic to make you think out of the box, and that's what happened with us. So when we had this lockdown and our customers, the pathology labs are working, we had to get our engineers to service the instruments. It was tough because the transport was limited, and how would they get to faraway places to service the machines? So we thought, why not get into Internet of Things and start servicing instruments with Internet of Things, and have, instead of having the preventive maintenance, right? So where the engineer goes to the lab and does the preventive maintenance, get into predictive maintenance. So through predictive maintenance, the instrument, the analyzer is connected through the internet, and at our central QC room, a central service room, we get all the analytics, the information, the data on how is the lamp life, how is the filter doing, how is the calibration of the machine going. So we launched this new instrument just about 3 months back, which is connected through the internet, and the data comes into our central service support lab, where in real time we're able to monitor the performance of the instrument. So before the instrument goes down, we can take preventive, predictive actions and avoid the breakdown. So I think this is something good, and we're going to start doing this on our other instruments also. So slowly we're going to have IoT connected.
Yeah. So on which kind of instrument it's already been implemented by you guys?
So right now you're done it on a biochemistry analyzer.
Okay.
So that's the first one we started with, and then we're going to now slowly start developing it on other analyzers. And we have given it a team. So I think another good thing is you should go look for academic partnership. So we're tied up with the engineering college. We are based in Maharashtra to give them this project to get all our analyzers IoT connected. So that's going on currently. But I think this is the future. You need to have, if your car can be smart, your fridge can be smart, your water filter can be smart, and why not the laboratory instruments?
So some of the side advantages of COVID, right, made us completely start thinking from very different angle. So
True.
So thanks, Abhinav. Now, cardiac disease, that's one of the areas which is major disease segment in India. We have seen quite a few innovation in this domain. For me personally, I have worked in R&D on one of the first cardiac focused CT scanner in early 2000s. So it's really very close to my heart. Now, Gaurav, you guys have done some amazing work in that area, right? You have done cardiology at doorsteps. You have done STEMI. Can you please give us some more detail on what are those things, and how have you taken the IOMT, AR, VR to the next level?
Thank you, Sanjay. So just a minor correction. CAD, which is cardiology at doorsteps, and STEMI India initiatives that some of our customers have taken. They are they are key opinion leaders in the segment. But you bring a very pertinent point. India today, cardiac disease is the #1 cause of death in the country, causing nearly 2 million deaths. There are about 55 million patients who suffer from some form of heart disease or the other. And there are two initiatives that I'd like to talk about, and they also touch upon a topic of digitally delivered healthcare. So one of them is cardiology at doorsteps. If on LinkedIn, you would have seen Dr. Padmanabh Kamath from KMC Mangalore. He has quite a fan following on Twitter and LinkedIn. And what he's done is something very effective and very simple. He saw that in and around Mangalore, there were a lot of coastal villages where even primary health centers did not have ECG machines. Towns that had population of 20,000, 30,000, 50,000, he would see those patients end up in his hospital in vegetative state. So using various NGOs, he got an ecosystem set up of about 350 to 400 echocardiography machines at primary health centers. And those doctors were connected to a WhatsApp group of 150 dedicated cardiologists. There's a patient who comes with an acute myocardial infarction or a heart attack simply. Doctor takes an ECG, sends it to that WhatsApp group. The doctor who has geographically greatest proximity to that private health center recommends a line of treatment. He has saved over 11,000 patients since the program started. Something extremely simple but very effective. He's also the winner of the Jan Aushadhi Award recently by the Prime Minister himself. So it shows that technology may not be big bang all the time. There are times when you can use technology in a rather simplistic manner to still make healthcare delivery very effective. Another, I'm very quickly be running out of time. It's a program called STEMI India, started by Dr. Thomas Alexander in KMCH Coimbatore. It has a very unique hub and spoke. There is an algorithm and there is a software that they install in the spokes. All those spokes collect a bunch of data related to the patient specific to heart disease that is transmitted to about 16 hub centers. And this has resulted in huge mobilization of patients who were so far untreated or would be undiagnosed. So programs like these are showing us that the next generation of healthcare delivery is indeed through connected, smarter, and predictive technology tools.
And thanks, Gaurav. Sumit, what do you think about this? Sumit, can you hear me?
Sumit, you're on mute.
Sumit on mute.
Yeah. So what's your take on IoT? How do you see it coming to the furniture business? You see it being used in future?
Sumit is on mute.
Yeah.
I guess some connection issue.
Sorry, is this question for me, Sanjay?
Yes, Sumit. So do you see IoT coming in the furniture space?
Right. So in terms of IoT, you're saying, right?
Yes.
So we are looking at ways in which we can connect our devices. So as when we look at physical assets within a hospital, it is very important to know where everything is located. So if you would look at a panel and see where your stretcher trolley is, where your wheelchair is, where your hospital bed is, obviously that's something which is going to become more and more important, and locating your equipment and to utilize it is something which requires knowing where it is for the best efficiency, and that's something which we are looking at. The other is remote nurse calling, which is integrating into the bed, and also informing the patient's relative or attendant would be something which we are looking at. So these are some of the areas in the IoT. In fact, in our US company, which is our parent company, they've already acquired a company in the US which allows for both human and physical asset tracking in the hospital. So to know exactly from a compliance standpoint where your nurse is, how many minutes did a doctor spend in a certain room or certain area, did the nurse wash their hands? So through Wi-Fi signals, that is something you can track, and that's the kind of technology we are looking at to bring into India at some point. It still is in fancy stage, but I think once that comes in, it can really help in bringing a lot of efficiency to the chief operating officer. I mean, in their dashboard, to know how much time is being spent where, and optimizing that, whether in the OPD or in the IPD, or how people are moving within the hospital and how's equipment being moved, is where we believe the Internet of Things is going to go in this space.
Thanks, Sumit. So we covered the majority of the medical device production side and distribution side. But for one of my old mentors used to tell me that in medical device, forget the product, adopt it. There are 4 A's. You need to make them aware, you need to make it affordable, the products need to be available, and it needs to be adopted. Especially for adoption circle. What is very, very important is training and education platforms. Okay, so how do we think that digital training and medical education platforms create value for this ecosystem through training and learning of doctors and nurses? Urvashi, I would perhaps is government looking into this area? Is there any policy you guys are trying to work on in this space?
I mean, training using digital technologies in general, yes, because as government we are looking at training in a much broader sense. So definitely that is something that also in the last year, because we could not actually do physical trainings, we did use a lot of digital platforms. We did use a lot of video modes, etc., to make sure that we could do training of master trainers, for instance. And even now in the vaccination drive, we are continuing to use a lot of this approach, because it's becoming increasingly very difficult to have physical, in-person, large-scale trainings. So I think in that context, this is something which has taken, it's definitely accelerated, but we have also started looking at it, before the pandemic, in the context of our health and wellness centers, for instance. Where we need to train, the staff there on aspects like non-communicable disease screening, because a lot of these centers and our primary health system in general has been geared up towards reproductive, maternal, child health services, and so a large part of our workforce in the primary health system in particular, and then when we look at allied health professionals, etc., as well, are not actually equipped to necessarily provide a lot of the services which we are now supposed to provide through these health and wellness centers. So the non-communicable diseases being one of the most important there, the geriatric care, mental health, etc. So definitely we are looking to use these sort of online platforms more and more to be able to provide these trainings, to standardize the trainings. Again, standards there, quality there becomes a very important aspect, because you can perhaps bring in greater standardization if you use these platforms. And then eventually, of course, also look at it in different languages, in sort of different shapes and forms that actually works for the very diverse population and also health workforce that we have. So I think we've made a start. And as I said, there was some amount of fillip that we got because of the pandemic, that we had to use these channels much more. But I think we will see that continuing into the future, and we will see it being used for different purposes, and also bringing in those standards and bringing in those quality aspects, as well as making sure that it reaches all parts of India, because it cannot be just one or two languages, or in something which reaches only a small proportion of the population and the workforce. So I think with all these factors in mind, this is something that we will definitely see the government also adopting at much greater scale in the time to come.
Thanks, Urvashi. Sumit, now you have been to both the sides. You have been to the hospital side with Fortis, and now with in the hospital furniture side. What's your take on this? How do you see this whole space moving on now? Digital training and medical education platforms.
Sorry, Sanjay, I'm not able to hear you fully.
So how do you think the digital training and medical education platforms, it will create value in the ecosystem?
No, there is definitely, training is to be imparted, and that is something which, that's why we call continuous medical education CME, and that is something which is integral in the medical field, because things are changing so fast, and there is a constant requirement for doctors, nurses, GDAs, you name it, technicians. Everyone should be trained on a continual basis. As a company, we invest in just educating doctors around and nurses around usage of our equipment, and obviously how to control infections and what we need to do in a hospital environment. So there is that level of training that is provided. Just I think any company would provide that, but I think there's much more value that has to be driven into the ecosystem through training courses which are available at leisure, which is through digital platforms, which is available today. But another thing which we did was with the state of Uttar Pradesh, we were doing GDA training. We had partnered with them, where we were taking young women and training them who were high school dropouts, and we had touched about 4,000 lives in the course of about 3 years, and we were recognized by the President of India and the Chief Minister of Uttar Pradesh for the work that we did. But there's a lot of opportunity to upgrade the skill set of people who can get into the medical field, and there's a critical shortage today of 2 lakh doctors, 4 lakh nurses, and 8 lakh GDAs, as they say. So how do we fulfill that gap? I think every company has to take it on them to really partner with state governments to uplift the skill set of the willing people who want to get into this field, right? And we contributed our bit by that, but it was in a physical setup, not digital, because we couldn't do that in these villages where we partnered with the local governments. But I think there's a huge potential across many states, and there's a lot of willingness by young men and women to get into healthcare. So that's something which I would also urge every company in India to look at as a way to engage.
Thanks, Amit. So, we are running out of our time, so I'm going to close the discussion here, unless any of you have questions for each other. So, with the paucity of time, what I would say is that, well, although we have come a long ways, but per capita spending on medical device is in India is still the lowest at around $3, as compared to like almost $30 in Brazil, $43 in Russia, $300 in USA. We are still a market that is struggling with quality issues, with affordable healthcare being a major constraint. But we have seen amazing work being done here. We have seen suddenly new companies coming up, things becoming much, much bigger. Vaccine, COVID times are amazing examples for what we can do. And we have seen attempts being made by government as well as private players. So personally, I do believe that we'll see India as huge medtech power in coming years. Thanks a lot, all the panelists, for your wonderful time, and I got to learn a lot from you. Hopefully, you guys had a good interaction, and thanks a lot, audience, for spending 1 hour with us, and thanks a lot, VOH, for organizing this event. Thank you, everyone.
Thank you. Thank you, Sanjay.
Thanks.
Thank you.
Thanks, Sanjay. Thank you, everyone. Yeah.
Hello. Good afternoon, everyone. My name is Madhur Singhal. I'm a managing partner at a consulting firm called the Praxis Global Alliance. A very, very warm welcome to everybody for logging into this platform and being an audience to this very exciting topic that we're going to discuss today. There's a very esteemed panel. We're actually talking about, of course, we've been battling as a country and as a world. We've been battling with the coronavirus for more than a year now. And interestingly, we look at it with mixed feelings. Especially given where we are in India, it's we're at the forefront of innovation, the forefront of supplying coronavirus vaccines, not just to Indians but also to countries globally. And in parallel, there's been a massive and ambitious self-sufficiency program, an aspiration that's been set by the Honorable Prime Minister of India, called Atmanirbhar Bharat. And so, at one end we have the coronavirus pandemic that we are all battling with. On the other hand, there is this massive opportunity for Indian pharmaceutical manufacturers and everybody else who participates in the value chain of pharmaceuticals. And I think that's why we have a lot of mixed feeling around the pandemic and the opportunity it creates for us as the market participants in India. And so we put this very exciting panel together, to discuss certain topics. We specifically talk about sort of COVID vaccines and the transformational impact that they've had on the ecosystem in India. We talk about self-sufficiency and import-export opportunities in domestic pharma. And we will talk about the competitiveness, and the role that different stakeholders are playing. That is something that, that's actually sort of an important part. We'll round this up with sort of the role that technology and research can play in sort of furthering the vision and really truly creating India as the hotbed of pharma innovation, production, and distribution. So I think, but before we get into the topics, I will actually let my esteemed panelists at least introduce themselves. Maybe I'm just looking at the screen in no particular order. Maybe start with you, Nitin. I'll keep calling out people. Nitin, over to you.
Good afternoon, Madhur and team members. Very happy to be part of this esteemed panel. I'm Nitin Parekh, Group Chief Finance Officer of Zydus Cadila Group. As you will be aware, this is more than 15,000 crore group and having a substantial presence in India, USA, and many other countries. We also have listed a subsidiary in the name of Zydus Wellness Limited, which has iconic textbook brands like Sugar Free, Everyouth, Nycil, Glucon-D, CONCLAVE. I handle finance, IT, and legal functions of the group. A total of 35 years of experience, including 12 years with Zydus, and has been part of its good growth journey, including various M&As, financing transactions, structuring, amalgamations, etc. And by our qualification, I am chartered accountant, chartered finance analyst, and MBA from Ahmedabad. Thank you.
Thank you, Nitin. As we were talking, I think there's a little bit of echo at your end also, so you might want to either get closer to the microphone or have some earphones on. But anyway, in the meantime, I'll move to Mahesh.
Yeah, hi. Hello, everyone. My name is Mahesh Kalsekar. I work with PharmaRack Technologies as their Chief Commercial Officer. Overall, 25 years of experience in the healthcare sector. Worked with companies like GSK, Takeda Pharma, and IQVIA in the past. In PharmaRack Technologies, we actually are trying to change the entire the way the entire supply chain and distribution is managed in the country. We are trying to digitize this, which is obviously the need of an hour. FMCG sector is far ahead of us, so we are looking at pharma sector also to catch up with them and get all the retailers, distributors, CFAs, and pharma companies on one single platform where all the transactions can happen. So we have the largest supply chain network in the country right now. We provide the supply chain efficiency services to the pharma sector and FMCG companies. We also provide data analytics solutions to the companies. And thirdly, we are now into the consulting solutions as well. Very recently, we worked with one of the biggest NGOs globally to actually help them design this entire COVID distribution strategy in the country. And I'm happy to be a part of this panel and like to contribute as much as I can. Thank you.
No, very pertinent, Mahesh. Welcome. Bodhraj, can I request you to introduce yourself?
Yeah. Good afternoon, everybody. I'm Bodhraj Sikri, having 50 years experience. I started my career from a state government, then central government, then public sector, then private sector, and 24 years back, I became an entrepreneur. Today, I am a formulator, I am a manufacturer, I manufacture intermediates, I am into Paris manufacturing, I am a trader, I am an importer, I am an exporter, printer, packager, and logistic business also I have. So I represent half a dozen national level pharmaceutical association. At present, I am the chairman of Federation of Pharma Entrepreneur, and I am going to be the chairman of CII Life Science Committee of Northern Region from 1st of April. And I'm also the vice president of BDMA, Bulk Drug Manufacturer Association.
Fantastic. We're very excited to have you on the panel, Bodhraj. Thanks for taking your time. Vikas.
Yeah, hi everyone. Good afternoon. It's wonderful to be amongst us distinguished personalities. I'm Vikas. I'm part of 1MG team, India's largest digital healthcare platform. We call ourselves digital platform and not a e-pharmacy or e-diagnostic simply because we are the pioneers in enabling integrated healthcare with the use of technology and enabling access, availability and understandable healthcare system to end consumers.
Excellent. Great to have you on this panel, Vikas. Rachis?
Hi, everyone. My name is Rachis Sella. I head business development and advocacy at Bharat Biotech. Pre-COVID, that was my designation. Post-COVID, during COVID, I'm the project lead for our SARS-CoV-2 vaccines. Thanks to Voice of Healthcare for allowing me to be a part of this distinguished panel. Truly humbled. A little brief on Bharat Biotech. We're a fairly young vaccine manufacturing company. We were set up 25 years ago. And in the last 25 years, we've developed 16 licensed vaccines. We have approximately 8 in the pipeline. We've recently developed the indigenous Covaxin, which is a COVID-19 vaccine. And we also have a few other COVID-19 vaccines that we believe will have the potential to get us out of this pandemic. Thank you for having me again.
That's excellent. Just and finally, Vishwanath. Vishwanath, you're on mute.
Yeah. Hi. First of all, a big hello to my fellow panelists and also for having me on this panel. Really great to be in this company here. So I'm part of Bharat Serum, BSV. We are one of the leading biotech pharma companies in India, primarily playing in the women's health and critical care space. We've recently made inroads into what we call as BSV with you services, where we are reaching out not only just to our healthcare practitioners, but offering cutting edge patient services as well. Look forward to the discussion here and see how we can push the agenda forward of continuing this journey that India pharmaceutical industry is on. Thank you.
Oh, excellent. Thank you, Vishwanath, and a very warm welcome to you. And thanks to Voice of Healthcare for actually pulling together a panel of this stature and eminence. For me, as I said, I run Praxis. I have around 17, 18 years of consulting experience. Started my career with BCG. Used to lead our financial services and consumer work there. Then I was an entrepreneur for a brief while, and then worked with Bain. I was a partner at Bain, leading our private equity work, private equity efforts, in India, and also spent a fair bit of time in San Francisco. Now, in particular, as a part of Praxis, we do a lot of work on the technology domain. Particularly we're leaders in health tech consulting in India. working with a lot of health tech players, investors, and now we have a pretty fledgling, a pretty booming pharmaceutical practice as well, where we work with large pharmaceutical companies and investors in their M&A as well as their organic growth strategies. So delighted to be and humbled to be moderating a panel of this nature. So let's without further ado, let's dive into the topics. Then Rachel's obviously your new designation. It's just tough to not look at your email signature. And so let's kick this off with you, given the COVID vaccine focus that we have. Do you want to maybe kick this off, talk about sort of how Indian vaccine manufacturers sort of think about their market strength now, think about building further R&D capability? Would love to sort of hear from you about the transformational impact that you think this made in India COVID vaccines, which you are at the forefront of, is going to have on the ecosystem more broadly.
Thanks, Madhur. I would first like to say that Indian vaccine manufacturing companies together, all put together, supply 60% of the global demand. And as you know, usually vaccines are given to prevent infectious diseases, which are more prone in infants and children. So these are primarily pediatric vaccines that we supply to the world. Coming to developing a vaccine, almost every vaccine is a novel process on its own. You can't make a generic vaccine. It's nearly impossible because everyone has their own technology to apply to it and develop it. But however, there are vaccines that have been there in the market for 10, 20, or 30 years. And I would say there's a dichotomy right now with vaccine manufacturers, where there are certain manufacturers that develop these vaccines that have been there in the market for the last 20, 30 years, where there's an established market. And then there are vaccine manufacturers that tend to develop new products for new diseases that don't have vaccines. I would like to proudly say that Bharat Biotech, our ethos is mostly about, we're an R&D driven company. Innovation is our second name. We've done this before. We've made indigenously developed rotavirus vaccine, which is a diarrheal disease that affects children. Approximately 2 lakh children die per year from this disease in India alone. So we've done this before with a huge amount of public-private partnership. What I mean by that, I'm referring to funding from the Gates Foundation or the US CDC or the NIH, and also with the All India Institute of Medical Sciences and various other universities. So that model has been established for a few vaccines, not only from Bharat Biotech, but also Serum Institute, Biological Advance, have all done these kinds of public-private partnerships to develop novel vaccines, so vaccines that are not in the market. So that ethos does exist in our system in India. What I suggest that what I see the future bestows upon us is that these things need to pick up. And I think with Covaxin, which is an indigenously developed product, most of our raw materials are also sourced within India. We have a few exceptions that need to be imported to the country, but we're trying to be as sustainable as possible. And I feel in view of COVID-19 and in view of the variants of concern, that these mutations are occurring to COVID, and small minor tweaks need to be made to these vaccines. I'm not saying that all these vaccines need to have these tweaks, but I feel that the scope of innovation and the scope of growth and to make something in India without external support is only going to grow upon us. And as the demand is so high within India and the world, and with our good capabilities both in academia and the government as well, I feel these kinds of platforms should all coalesce together to develop, I would say, better pandemic preparedness in case we have another pandemic in the near future.
And Regis, is there impact on our R&D prowess, orientation, as Indian manufacturers or Indian innovators? Do you see that having changed in any way, given how short the duration for this innovation and product development has been?
No doubt, it has changed. I can give you a case example of Covaxin. What we had started in May, which was quite late to the first generation COVID vaccines, but with our collaboration with the ICMR and the National Institute of Virology in Pune, we were able to quickly co-develop this vaccine together. And there was constant data sharing. Usually vaccine companies are always hush-hush about their technology, and they don't like to disclose such information because that's what makes us novel to develop this vaccine. As you know, it's extremely complicated to develop a biologic. But I think that open kind of transparency with a government-run organization was one of the prime reasons why we were able to develop this vaccine in short space. But I feel in light of COVID-19, I feel India knows that it needs to have a much better response, not only with vaccines, but with diagnostics and with therapeutics as well. So I feel us manufacturers, the private sector, should come forward with a proposal potentially involving the government. And also, I think it's very important to involve academia as well from India. We have really good universities here that that are still untapped, that still do not have dealings or joint projects or co-development projects with private organizations. So I feel this lays the foundation for things to improve upon, and I think we should really learn from the mistakes and be better prepared.
No, excellent. I think so. Bodhraj, you've been in the government, you've been in private sector, you're now an active participant in the ecosystem. How do you think about the impact that these the made in India COVID vaccines have had in the pharma community in general?
Thank you. Not only vaccine, I would like to cover pharma industry as a whole. So this Atmanirbhar Bharat, this mission announced by our Honorable Prime Minister, basically it is the soul of our industry. 20 years back, we have been making a lot of representation on behalf of the industry to the government, depending upon one single country for 68 to 70% for sourcing of raw material or intermediate or key starting material. We were in a very dangerous zone. Unfortunately, nothing happened. A lot of committees were constituted, a lot of efforts were made, but it was a futile exercise. Finally, in 2015, I remember when Mr. Anant Kumar was the minister, unfortunately he is no more, he announced 2015 as the year of API, bulk drug, because our main dependability is on the bulk drug. So that was 1 year where a lot of interaction took place, a lot of seminar took place, a lot of workshop took place, a lot of discussion took place, a lot of deliberation took place, but unfortunately nothing happened. Finally, the COVID has come as a blessing in disguise as far as country is concerned, as far as our industry is concerned, because good sense prevailed in the mind of the government. In October last year, they announced PLI-1 scheme, which was really a very big boost for the industry and for the nation particularly. 25% of the dependability from China can be reduced if that is going to be 100% successful. The response is quite good for PLI-1 scheme, where they are giving 7,000 rupees as an incentive to the industry if we are going to produce the product, 43 product, which China is at present sending it to us. So similarly, about a month back, they made another announcement, PLI-2 scheme, where 15,000 crore rupees budget allocation is there, but that is for the existing manufacturer, where they are going to cover formulation, they are going to cover intermediate, they are going to cover API also, R&D, innovation, export, a lot of incentives are there. And similarly, they announced 3 PAR, bulk drug PAR. Against that, 14 states have applied. So 3,000 crore budget allocation for that. So PLI-1, PLI-2, and bulk drug PAR, these 3 elements, if you calculate 25,000 rupees, is not a small support the government is going to give. And the response seems to be quite encouraging, and I am fully confident that industry is also equally concerned, like government is concerned, and day is not very far. Only last statement I will give against this question. See, there is a saying, where there is a wisdom, there is a science, and where there is a science, there is a prosperity. If today US, Germany, Australia, Japan, why they are prosperous? Because timely they converted their wisdom into science. And India is realizing that conversion now. Although we have been innovator like Bharat Biotech, Mr. Ella has given a very good presentation, and we are proud of a company like now Shanta Biotech has become a Sanofi. Otherwise, that was also one of the Indian company like Bharat Biotech, and they have done wonders. So my only submission is that this "Made in India" slogan is really going to be a real. That it is not a dream. It is going to be a real document, and day is not very far. Every good thing has a ridiculous beginning. Day is not very fast, and the entire world, which is already looking towards us, is really going to have more confidence than they have today.
Yeah, no, very exciting. And let me actually turn this to Vikas then, who's been a pretty successful health tech entrepreneur. Vikas, how do you see this vaccine, in particular, having an impact on the ecosystem, and and also possibly on how consumers are responding to health and wellness needs?
I think very well summarized and covered by Rishis and Mr. Sikri. COVID certainly has opened up a consumer mindset which was at a cusp of experimenting or participating in the digital healthcare front. I think with COVID, not only consumer side but the supplier side, doctor side, manufacturer side, everywhere you see the penetration of technology, or now how they look at the ecosystem being enabled by technology is very different and very forward looking. I think from an overall perspective, there are 2-3 main buckets which I see moving. I think one of the main things which can fundamentally shift the entire industry is the active participation of the right government agencies. I mean, at the scale that we are talking about, building an integrated system, a system like CoWIN, where a complete technology infrastructure to track trace the vaccine program at a billion Indian plus level. It's amazingly well how different agencies and infrastructure are coming together to deliver that. We are in an initial stage, so there are certain challenges we might have seen. But any program, any implementation of this scale would bound to have these initial hiccups. But the direction, the amount of effort, and the thought process is very well placed. So you're looking at an infrastructure which can play a significant role in envisioning a unified health infrastructure or a unified health scheme or a unified integrated system that can fuel different NHS schemes and things like that. So it gives you a real fundamental established system that you can look at consolidation on different entities or whatever that can happen at a central level that was missing, and that has opened the way. Second is adoption of technology at the consumer level. In general, there are certain progress and strong progress has happened. But in healthcare, if you look at people trying to register on a COVID for vaccination, opens up a lot more, be it with e-Sanjeevani, be it the teleconsultation that has taken up, and obviously the transactional services. So that is the second largest piece that's come together. And third is if industry can adopt it and build models, solutions, innovation on top of it, you're looking at opening up or a starting of the digital era for healthcare. So that's what we see COVID and vaccine from my perspective, from digital consumer standpoint.
Got it. No, this is I think makes a lot of sense. I think the consumer awareness around health and usage, accessing healthcare services through technology has clearly come to the forefront. In fact, on that note, Mahesh, you've seen sort of the distribution side, of pharma for a long period of time now. What capabilities or capacities, do you think, India, and I know you participated in some vaccination rollout as well. Talk to us a bit about how do you think, those aspects of the value chain have changed because of Made in India COVID vaccines?
Sure. So, first of all, this entire drive currently is managed by UPI, the government program, that is Universal Immunization Program. Now, as of this, UPI was established way back in 1978, primarily to conduct all these immunization programs. And as of today, it's very successful, and they have covered almost 60 to 63% of the population in the country, which is a commendable job that government of India has done. Now, if you actually look at the kind of capacities that government has developed, they already have more than 2.5 lakh healthcare workers involved in all these immunization programs as of today. They have 5,000 metric tons worth of cold chain storage capacity that has already been developed by them. Now, if I just have to give you some kind of an idea about this, Okay, there is the cold chain storage is the most important thing for vaccine manufacture. And when I talk about storage, it is the actual warehouses as distributors, as well as the transportation, because all the transportation is conducted through a cold chain vehicles. So you cannot use the normal vehicles which are used by the pharma industry or any other industries. Good part, according to us, is that we have enough cold chain storage capacity right now, half with government of India and also with the private sector as of today. If government of India, get the private sector involved in this entire exercise, we can easily manage the kind of task that government has in front of them to vaccinate 30 crore population by July 31st this year. However, if government decides to go ahead only on their own, we think that they may take another 5 to 6 months of time. We have done some calculations, back of the envelope calculation based upon the total population to be vaccinated, the total storage capacity, total transportation capacity, the total number of healthcare workers which are available in India at this point in time. And we think that participation by private sector could be very, very essential or important for us. In fact, from cold chain storage capacity, we also feel that there is another sector which is called as ice cream sector, and they also have a very huge cold chain capacity available with them. And fortunately, after this May and June, the entire optimization of the cold chain capacity goes down quite significantly. So there is a huge capacity available in India which can easily be utilized for this entire COVID vaccination drive. According to us, there are 5 key levers which will make this entire drive successful. Number one is obviously the manufacturing capacity, and obviously the people who are in this panel are the best people to talk about manufacturing capacity. But what we learned is that we have enough manufacturing capacity not only for the domestic need but also for the exports. The second one is obviously manufacturing of syringes, vials, and other peripheral products, which is also very important, which we need to take into consideration. Again, our analysis says that India is good enough to go ahead with it. We really don't require to ramp up the manufacturing facility over there. The second one is transportation, which is primary as well as secondary transportation. Primary transportation is from the manufacturer to the warehouses. The secondary is from the warehouses to the actual administration sites, the hospitals or wherever these camps are being conducted right now. The third one is cold chain capacity at the distributors and warehouses. The fourth one is actual storage and administration capability, which involves manpower and all at the sites itself, which includes admin staff, nursing staff, as well as the other doctors and all. And the fifth one, according to us, is actually influencing patients to come to the sites and get vaccinated. Now we think that this is like a cohesive 5-step process that government of India is managing right now, right from manufacturing the products or accessing the products from the manufacturer, using the transportation facility, as well as having the right kind of a communication right now to have the patients or normal people coming to the sites and getting vaccinated. So we think that government of India will be able to manage this, but the role of the private participant, especially in phase 2, will be very, very essential.
Very, very interesting mention. And Nitin, you see the domestic, pharma manufacturing and distribution quite closely. Are there? Do you see any changes in import dynamics or just overall trends around how the drive towards self-sufficiency? How potent is it? Any thoughts on that?
Yeah, there have been some dynamics in terms of imports. If you look at 2 factors. One is in the last couple of years, geopolitical kind of issues that at one level we have been seeing among major nations of the world. Second is what is caused by the pandemic. Now, the first major shift that we see in terms of import is from whichever countries we were importing our imports, including APIs, intermediates, PS, and other things. They all of them have started giving importers to the domestic industry first in terms of priority, and therefore the impact of this is in terms of the lead times quoted for most of the inputs that you have been importing from other countries. That is one impact. The second impact is that during the pandemic, many countries have realized that whether the cost of the production makes sense or not, but for for certain essential medicines, they need to have self-sufficiency. And there the economics are less important, but the sovereign, interest or the interest of the nation becomes of paramount importance. And therefore, many countries have started reducing the reliance or dependence on import from China as one country, for example, and have started looking at other sources, including European sources. To our surprise, we have found that certain European countries are not necessarily in terms of cost, costlier than China. And at the same time, the price difference are not so significant because there also we find manufacturers with good size and scale and therefore in a position to give economical prices.
No, I think we go on, Nitin.
Yeah, so countries like India, as specifically also mentioned about the PLI scheme. So the first PLI scheme obviously was aimed at more from API and self-sufficient sort of APIs and base and intermediates and also molecular parts. The second, which is to more encourage incremental global revenue as well as incremental capital investment, even while existing units. Obviously, that's also in terms of amount, but roughly about 25,000 crore outlays on this, I think, is quite welcome step. What we also experienced in terms of import is that, especially the products which are related to COVID, including something related to vaccines and other COVID treatment, the input prices of some of these goods have started increasing. One, because of this, demand supply gap which is created. Secondly, we also see some of the units not being in production, even like take the product like paracetamol, prices have gone up by about 100%. So that is the impact in terms of the import prices. Some of these things are of short-term nature, and the long-term directional steps like PLI scheme, which will take some years before starts giving results. I think countries have been thinking about self-sufficiency.
Got it. No, when you say Vishwanath, while we're talking about sufficiency and the PLI scheme, I think one thing we cannot disregard is how competitive will we be, right? If we need to produce for our own country's needs, that probably is okay. But for this to sustain and truly have economics that will last for a lifetime, we need to be competitive. So, Vishnu, from your vantage point, how do you think about competitiveness, and what does it take for us to truly be the pharmacy of the world, as some of the newspapers and media is talking about?
Right. So, no, first of all, I'll kind of build on the positives also, right? Let's not kind of look only at what needs to be done. Let's first also focus on what we've accomplished as a country and as an industry, right? I think Rachis very rightly said we supply close to 50 to 60% of the world's vaccines. 1 in 3 pills in the US are made in India. If you look at roughly about 25% of the medicines in the UK are from India. We've also had a very positive impact in the world, where if I just look at the penetration of medication for AIDS in Africa, right? Way back in 2003 or odd, it was less than 1 to 2%. And when the Indian pharmaceutical industry got involved in that, it shot up to about 35 to 40% in about 5-6 years, right? That's the positive impact that we've had not only in India, but across the world. If I look at us as a sector, we are the 3rd largest sector. We have the most US FDA approved plants, close to 250 odd, right? And when we look at the sector, I think we need to just not look at pharma and formulations, but if you look at the biotech services, which is broadly emerging as one of the bigger themes, we have more than 50% share, right? If you look at our research and manufacturing sectors, right, they are growing at about 25% year on year, that kind of pace. So all positive, all good, pharmacy of the world, great title. But let me flip it. We are also one of the largest importers of API. Last year, I think we imported close to 25,000 crores worth of API, and from our neighbors, most of it, right? Now, is that something that we need to focus on going forward? Absolutely. We say pharmacy of the world, right? But if I look at ballpark numbers, right, overall, our exports are around $20 billion, right? Give or take a few. The global pharma industry is $1.5 trillion, right? You do the math and you figure out, yes, it's still a little bit drop in the ocean of where we are, right? So I think when you start putting this in context, yes, we've made a lot of headway, but we have a way long to go. And I think the government is taking some actions, right? Very clearly, it was pointed out, the PLI scheme which has come in, I think that will be a boost. The government is putting close to 15,000 crores there. There's an announcement of developing 3 bulk drug parks. They're going to help us in the long term. Now, what we also have to understand, there's a gestation period. This is not going to happen overnight. What actions we take as a country, as a government, as an industry, will take about 3-4 years to kind of fructify, right? But just if I look at, capital coming in, government easing out, there's also, we are going to run into a need for skilled labor. So are we preparing a workforce that is ready to serve this surge that we are seeing, right? That's one of the areas that we need to focus on. How difficult or easy it is. And you've got a lot of people who are into manufacturing and their own setups over here to set up a plant in India, right? The licenses, the approvals which are required. And I think not just capital, it is just taking a holistic approach will be something which is required. And then very pointedly, because it's become very, very apparent with this coronavirus situation, that we need to focus on some of the very critical APIs. Some of the APIs, if you look at it, we have a dependence of 80-90% on one country, right? And that's not sustainable. You will be subjected to supply shocks, you will be subjected to price movements, which is not good for the industry and eventually not good for the patient, right? And I think once we start looking at it in a holistic way, keeping the patient at the center, I think a lot of these things start making sense. So again, in summary, I would say a lot of positives, and we should not shy away from that, right? We are the pharmacy of the world, and I can go on and on these numbers. But I think we need to take a little bit of a holistic view, capital, ease of doing business, providing the skilled labor which is there, and being very strategic, saying, let's look at, the high dependence APIs, high dependent drugs, the most critical drugs, and how we start building those capabilities in the future. And I think that's what is required going forward.
That's very interesting. You gave a $20 billion number. I was talking to Bodhraj separately, and he spoke about $120 billion numbers, target by 2030. So maybe, Bodhraj, how do you layer onto what Vishwanath has spoken about, and how do you sort of bridge this gap? How do we become 5-6x of where we are today? Sorry, Bodhraj, you are on mute. Apologies.
Yeah. See, what he is talking at present, India is doing approximately 22 billion export, and same amount we are having domestic business. Now we are talking about 2030. Now people must be calculating how is it possible that by 2030 India will be able to have $100 billion pharma business. I give you, there are 30 reasons. There are 30 reasons. I'll be able to narrate half of that, why we will be able to achieve. Number one, if you have heard this budget, current budget by Nirmala Sitharaman, out of 6 pillars, the first pillar she was talking about the life science industry. First, and if you are seeing the budget allocation, at present 1% of GDP was for healthcare sector, which is almost 2.5% now. That's the intention of the government. And changing lifestyle, affordable and efficacious product being given by India, and global population increase, and out of 65% population which is in rural India, 20% is being fed by the industry. Balance approximately 40 to 45% is not being fed by us. That is one area. And secondly, this year budget, I told you, increase in the disposable income also. If you see, over a period, increase in the disposable income is there. Ayushman Bharat, 50 crore people are covered in that. Ayushman Bharat, Jan Aushadhi. Last month, I was invited by Doordarshan to speak on the Jan Aushadhi. 10,000 stores are being opened. They already have 7,500. See the intention. Similarly, massive expansion of Jan Aushadhi project and free distribution of medicine in the wellness center, which every year they are increasing. And rising healthcare spending by the individual is another reason. And rapid urbanization is another reason. So similarly, increase in the government spending on national rural health management is one reason, and Government of India attitude towards position, the state of mind of the government is also totally changed. So these are some of the factors which are really going to prove that 120 billion is not difficult to achieve. We expect this growth of our industry, and if you have seen Bombay Stock Exchange and Nifty Healthcare Index, that also speaks how we are really going to grow. So before I conclude, but recently now, like Vishwanath was talking about the positivity in the beginning, I also gave you a positive aspect, but now I'm going to give you some little bit gloomy picture also. Of late, you all are from pharma background. China has started arm twisting. The raw material prices, penicillin G, paracetamol, common medicine, the raw material 250 rupees to 650 rupees. Now the arm twisting, and then they have started making the cartels. So that is going to affect the industry and the consumer and to the patient in days to come for a couple of years. But we have to face that. And to achieve all this, there is a need for early stage R&D support also. That is where I wanted to touch the subject. And academia in industry collaboration is also lacking. That concept also has to be. Technology trend in pharma is changing fast worldwide. But unfortunately, if I talk about our industry, domestic industry, Indian pharma industry, they are not trying to match with the overseas requirement. So these are the area IT skill. We talk about the leader of the IT, but can we say about the pharma? Sometimes, unfortunately, no. So that is where we again have to have improvement.
Interesting, very interesting. In fact, you've developed an indigenous vaccine which is now under rollout. From keeping this whole sort of pharmacy of the world and a 3x to 6x growth going forward, from a drug development, talent, regulation perspective, IP protection, like what do you think needs to change? Like what will be needed to truly become as big as the opportunity that is standing in front of us?
No doubt a whole lot. As Mr. Sikri mentioned, we have an enormous amount of competition from China, especially from a vaccine point of view as well. They seem to be mass producing vaccines at much larger scales than what we are usually accustomed to in India. So I think from a drug development point of view, I think the whole focus would be on R&D, making internal and external R&D decisions. I think it's very important for every company now to start having its own R&D department, I think, which is quite nascent in India, both from a process development point of view and also from a research point of view as well. External R&D also, as Mr. Sikri mentioned, that dialogue between academia and the private sector is completely lacking, in my opinion, especially with the vaccine industry. I do understand that making biologics is a complicated process, and these universities probably don't have the funding to do this kind of bench-related research, but I think it's very important. And tomorrow, if you want to make an mRNA vaccine or a viral vectored vaccine, you don't have the capability to do it in India. You can't tie up with an academic organization or the government research organization to do it because it's non-existent. So those kind of technology platforms that will help vaccine manufacturers be better prepared for pandemics. So these are platforms like the viral vector vaccine, like what AstraZeneca and Johnson & Johnson have made, or the mRNA vaccine platform, which is Moderna and Pfizer. Those kind of platforms, if they can be at least developed by research institutes, either in India or the government organizations or the private sector as well. And if they're open to tech transfer that out to other manufacturers as well, that's great. And that's how we will be able to continue to innovate in India from a drug development point of view. Coming from the regulatory point of view, I feel that, I'm sure all my pharma colleagues will agree, it's extremely a strenuous process to deal with the regulators, not only in India, but in the world as well. There's so much of, there's a lack of uniformity, to put it straight. With India, they call it a single window opportunity here with the government, with the regulators. But once you open that one window, it opens up into a several cascading window effect. I'm learning this along the way. I'm quite new to the industry, about 5 years. But what I've witnessed is that the regulation in India is far more stringent than even the WHO or the EMA related regulations. And I feel if that could be relaxed a little bit, if we could try to sync our regulatory expectations in India with the rest of the world, we'll be much quicker when it comes to rolling out vaccines. And I honestly feel that Covaxin's timeline could have been expedited by at least 45 to 60 days if we had a little more of a relaxed regulatory expectation. Coming to the IP related, from a vaccine point of view, my colleague Mr. Swaroop will also agree with me here. Vaccines are highly regulated technologies. Everyone has their own IP on vaccines. And I think all vaccine manufacturers swear by IPR protection. I don't think our motive is to infringe on any of these intellectual property rights. And we tend to always file patents. Bharat Biotech has filed approximately 427, and we've been granted approximately 150. And when we file patents, we file it worldwide. And we're always eager to know what our competition in India and externally are doing as well, so that we ensure that their interests are also safeguarded.
No, very pertinent, Rachel. Nitin, maybe turning back to you, as API and pharmaceutical manufacturers, what else? I think we spoke about vaccines and biologics in general quite a bit. But from a formulations and APIs perspective, anything you would add to what Rachel and Vishwanath spoke about?
So we have been talking about India being pharmaceutical world, and I think Vishwanath mentioned about various statistics and contribution of India in general in USA, UK, other parts of the world. So what we are basically making is more in terms of R&D, which Stella also mentioned about. So far as the generic is concerned, I think we have a good share of the market. Talking about USA, we have almost 40% of market share in the US generic, US industry. What we have done in recent past, including what we have done in terms of vaccine front, I think the world is certainly looking at India with a lot of respect and gratitude for what we have been doing in terms of reactive and preventive treatment of COVID. When it comes to competition, side, let's say if you talk of USA, the Indian companies are competing with other Indian companies. Because we compete with European and other Asian countries also, but there is a lot of competition in terms of generic space. China has been, for quite some time trying with formulation industry, trying to compete with many Indian players in US and other European market, but they have not been very successful till this time. Maybe the focus in terms of chemical synthetic skills or quality or other aspects, they need to continuously improve. And what China has been doing because of that is to acquire the companies in other countries. That's the way they are trying to reach the world, including USA, by acquiring companies in the Asian part, including India. National priorities are many, because which I touched base earlier. Most of the countries, they have started trying to reduce the reliance on imports on one or two countries, especially for essential medicines. When it comes to growth and this vision of 120, and this one mentioned, and then followed by you said that 22 million is only the export part, so about 40 billion plus is what our market is. From that to reach almost 5 times in, let's say, about 10 years. While the good stretch goal is not impossible, two approaches I think will make sense. One, when it comes to generic products, the emphasis needs to be given on large scale, the way some of the other countries have done. Very large scale, cost-effective way of handling the manufacturing operations, and you become the generic window for the world. The second part, which is where we are making a substantial emphasis to be given, is on innovative products, and that's the biosimilars, where a lot of things are still going to be required to be done. We have our own contribution, but still needs more attention, more emphasis, and there the government can help. For example, we had this 200% weighted investment for R&D earlier, which is now a problem. I think the government possibly recognize the importance of research in this pandemic, and if this 200% weighted reduction can be brought back, I think that would be enough in terms of the innovation efforts.
Got it. No, I think very interesting, because from a from a health tech perspective and just enabling access to consumers for all kinds of healthcare products and services, what is the role you think health tech sort of plays in truly helping us achieve this vision overall?
See, when you talk about a program of this massive scale, given the length and breadth that it needs to reach, the only way to make it accessible to every individual is with the use of technology. Now, there are multiple components which are there, and be it on the supply side, be it on the consumer fulfillment side, be it on the information side, technology plays a very important role on each of the aspects. The first and foremost is understanding the basic the plus and minus that can happen, the negative information, how do we curve down, how do we make consumers really aware on the right information. So technology plays a very significant role on the first aspect. Second is enabling the whole the back end of it. So from a site where it is manufactured to a place where it needs to be fulfilled, the entire capability to be tracked, traced, temperatures being maintained, authenticity to be checked, all those aspects is another aspect which technology can play a role. And third is the consumer interface, where you have limited number of sites where vaccination can be done, or any of the service from a healthcare perspective that can be delivered. Now, how do you enable a scheduling so that there is no overcrowded, there is convenience to the consumer, the entire process, if it's taking 2 hours, the consumers are not waiting in line, the scheduling of 30 days, 60 days, whatever the time frame for the next dose. In between, if you face any issues, how and when, and enabling the access to a teleconsult so that if the consumer faces an issue or a health aspect, that can be addressed. So the complete life cycle of a vaccine, from manufacturer to the end consumer and then administering it, and the entire life cycle of a consumer, right from access to the right information at the right time, scheduling, administration, the second dose, in between, and post that. The entire aspect can be very well managed with the use of technology. And then the third aspect, which is a central database or a central system or a universal gateway, passport, whatever you want to call it, where if you're traveling, resuming work, going to a mall, using a public transport, how does that also get enabled once you have a tag or a green light or whatever the tick that you can do, be it enabled through an Arogya Setu app or something else, that again can be very well easily be managed with a technology system.
Understood. And how about Mahesh, from a distribution standpoint, what is the role that you see different stakeholders can play in helping us achieve this sort of massive self-sufficiency and a $120 billion target vision? And is there specifically sort of role of technology there? It would be good to understand from your perspective.
Certainly. So first of all, let's understand how this vaccine industry is different from pharma, and how pharma is also different from FMCG or pharma industry in the other countries. So if you look at Indian pharma market and pharma distribution channel, we have more than 40,000 distributors over here, and these are all private third parties, which actually manage data distribution from manufacturer to the end customer. As compared to the other countries, the more regulated and developed countries, which manage this entire distribution with just 5 to 7 distributors at a national level. So obviously, manufacturers have to deal with multiple stakeholders over here individually. So that obviously induces that much of complexity in the entire system. Secondly, most of these distributors in India are also the individual third-party non-exclusive players, which means that a company does not have their 100, 200 or 500 distributors. They are the common distributors among all the companies. So obviously, the companies also cannot dictate their distribution. They have to be dependent upon the distribution strengths of the individual distributors. So what happens, or what has happened over a period of time in the past is that there are certain states which are more advanced in terms of distribution channels as well as usage of technology. So if you look at southern states like Tamil Nadu, Karnataka, or for that matter even Maharashtra, Gujarat and all, they are far more advanced in terms of usage of technology as well as their distribution strength. Whereas if you look at more of the northern or eastern states, then obviously there are challenges. There are challenges right in terms of usage of internet over there. Their internet connections are also not available 24/7. So in that phase, how do you expect a full transparency of the data, management of temperature control vehicles and temperature controlled warehouses in states and cities like that? So what has happened, unfortunately, is that we have been quite successful in managing all these drives in the metro cities and perhaps a few class 1 towns. But when it comes to the class 2 towns, lower town classes and villages, I don't think we have even attempted right now. Even when you look at this entire drive of government of India, they have really not reached out to the villages at this point in time. So that will be phase 2 of this 30 crore population that they're talking about. Now, this is where the usage of technology, internet connectivity, transportation, the trucks and vehicles with continuous GPS monitoring as well as the temperature monitoring are required. And are we really ready with that? I mean, my answer is no. Can we be there, or can just to beat that $120 billion worth of mark? Can we go there? Forget about exports, but can we really manage that within the country itself? I would say there is a lot of work that needs to be done, especially in those 8 or 10 states and lower town classes and villages. Now, is government of India taking efforts? Obviously, as I've said, in India, this vaccine market is primarily managed by government of India and not the private players. There may be manufacturers of vaccines, but the actual distribution, 70% plus distribution of vaccines and administration is managed by government of India, not the private players. And I'm talking about in volume terms. So obviously, government itself has to take a lead role in terms of, getting these private players also, get the usage of technology primarily in terms of inducing transparency in the system. And technology is the only thing which can give you transparency. Can you track a vaccine manufactured at the manufacturing unit till it is administered to a patient? Is there a mechanism where you can really track it? You can find out whether it has expired, not expired, take care of reverse logistics. All these things are currently not possible. These are all manually managed processes. And that's where the real improvement area is envisaged. And I personally think that is where private players as well as government of India needs to play a very, very important role.
Correct. So I think that's absolutely. And what are the, I think maybe from Vishwanath again, what is the role that you see sort of technology play end to end in the value chain? Is there something that you would share from your experience that you've seen working, or what you think needs to be the focus of the different ecosystem participants?
Sure. So, Madhur, I think everybody's kind of moving in the same. We need to build the capability for future and how we get there, right? Now, I think what we forget when we're talking about this, we're also the technology capital of the world and we're also the back office of the world, right? So we've got all the homegrown technology and tech wizards available within the country. Fortunately or unfortunately, or just in any regulated industry, the embracement of new things is a little slower. If I look at our FMCG peers, they have moved ahead in terms of embracing technology. But I think there are early signs of what we are seeing. If you look at just the implementation of AI or ML in drug discovery and drug development, I think we made huge strides over the past 5-6 years, right? 3D printing in prosthetics, if you look at it, that's also becoming a decently sized trend. Now, one of the things that I feel is blockchain. Again, we are a little bit slow to kind of get to there. It's more of a buzzword today. But if we implement something of that sort, you will find the entire end-to-end transparency, the traceability, ensuring drug authenticity of drugs, which is again a little bit of a challenge in our environment at times. but also when we are exporting outside. I think those things will become that much more transparent. RFID technology is another one where I see, just end-to-end development, how you move goods, how you manage your inventory, right? We talked about how many distributors you have, how is that tracked? Within the hospitals, our hospitals are becoming much more sophisticated. How do they track their inventory of what is sitting in stores versus IPD, pharmacy, etc.? Are big initiatives, right? The last I would say, and the most important, is the patient interface. I think we all have experienced, thanks to COVID in some sense, the telehealth, right? Telemedicine. That's again, in my mind, a very important critical technology to actually bring healthcare down to the lowest part of our pyramid, right? It's very, very important. The government is, of course, doing its own bit in terms of coming up with the health ID. But I think if you look at just simply our telehealth or telemedicine guidelines, right? I think there's an opportunity to actually refresh them and modernize them and make it relevant to our times, right? There was a mention of the apps that the government has had, right? Arogya Setu and CoWIN. Just imagine the amount of data that we would have collected at the back end, and what that data can help us do in terms of, really forecasting the trends, understanding where our population is, what are some of the pockets. I mean, it's a AI so to say dream to kind of mine that data and really understand what trends can be figured out. So I think what we really need to do is merge being the pharmacy of the world as well as being the back office or the tech capital of the world, and bring this together end to end, from drug discovery to actually delivering what value to the patients. Again, we've got a broad and a very big bottom of the pyramid population that we tend to forget. And I think when we were talking about that, serving that is another mission that we need to take over. And technology is the way we can reach in a very, very economically viable way. So I think end to end, there's clear use of technology. I think we are starting, we are a little slow, but that's given any regulated industry would face that, right? But as we are unshackling ourselves, I think we need to just move fast on this trend.
Got it. No, I think this is where you say, Bhutwaj, I think from your perspective, any, when you're moving to closing thoughts on role of technology, how do you, is there anything else you will add beyond what we've heard, very, very interesting perspectives from everybody else on the panel?
Yes. Time is changing. The circumstances are changing. The demand and supply scenarios are changing. The expectation of the patient and doctors are changing. So with those changes, unless we change our technology front also, we will not be able to achieve what exactly we are targeting. Because as I told you, we are mainly focusing on the backward engineering. We have to talk about the R&D, we have to talk about the innovation also. Unfortunately, Government of India has withdrawn some of the R&D incentive. So I would recommend upgradation of technology is one area where we have to focus, and approval of research-based product have to be given priority, like vaccination. Vaccine is precondition, that should be first. And any new molecules, if it is an import substitution by way of innovation and by way of technology, that should also be given some special consideration, and all the regulators should have dedicated wing for vaccines and new molecules which are going to be the import substitution. And ease of doing business, what we are talking, is only on paper. I have seen in China myself what exactly is the real definition of single window, and what is the ease of doing, and what is the deemed approval. That concept is lagging. And lastly, investment in information technology and in artificial intelligence is also strongly recommended, in addition to technology upgradation what we are talking.
Got it. No, I think makes a lot of sense. I think while we're coming to the close of this session, I think we lost Regis in the middle. But any closing thoughts from you, Nitin? Let's just start from, I think we're at the top of an hour, so maybe just last sort of 60 seconds from you. How would you round up this discussion from your perspective?
One point on technology before we go. So I think technology has been making good strides, so the adoption is lower. Because what we have seen is that in our manufacturing setup, we already started utilizing machine learning and AI. We are looking at the change of business model, which possibly in my view will come much faster than what we might have anticipated. terms of the companies to doctors and doctors to patients, I think the things have been rapidly changing. We have been already using technology in terms of predicting the success of clinical trials, clinical conducted. In marketing, a lot of many things are done, and having the greatest use technology on an immediate basis will be technology for distribution logistics. I am very confident that this industry has done and is poised for much better growth in times to come, becoming more resilient, more cost effective, and innovation and technology driven.
Very sort of words of wisdom there. Anything, Vikas, how would you sort of round off the conversation overall around, we becoming sort of people in India getting access to drugs and vaccines and so on, and overall we also becoming a global supplier of scale and significance?
I think multiple viewpoints that have been shared, especially around the part that a regulator needs to play, their part as an industry participants we all need to play, and the role of technology in binding together all these elements to deliver a unique experience to the consumer and bring out the best products and keeping up the spirit of Atmanirbhar Bharat. So multiple things will work that will enable as mentioned and discussed during this. I think two things which I feel significantly can differentiate and fundamentally move any sector. One is the role of the regulator. So the more ease of doing business, single window, not opening into cascading windows and things that other partners have mentioned. I just like to add one point in that is there's look at technology as the enabler and not as a inhibitor. So this industry largely, until unless you look at incumbents adopting the technology, a significant fundamental tectonic shift will not come. So how do we look at adoption of technology from an incumbent side and how regulators can play a role in it? So that's one. Second is on the consumer side, I think we can significantly change the access of primary health and multiple other life cycle interventions from a healthcare point for the consumer. How do we look at enabling that as ecosystem players coming together and solving that? So those were the two takeaway points from my side.
Well, very interesting. Vishnath, any closing thoughts from you?
No, I think first of all, very nice discussion, and I really appreciate the thoughts brought up by all the panelists. I think this is a strength that we have built over as a country over the past several years. We are the pride of the nation, and I think we need to position ourselves as something that we are batting from a position of strength, right? And yes, there will always be areas of opportunity, but I am an eternal optimist. And I think if we put the discussions that we've had today, even if we would put 10 to 15% of these into action, I think the goal of 120 billion is not too far away, right? And I think that's what we need to kind of, and being participants of the industry, I think we just can't say it's all the government. The onus lies, yes, with the government, but us as well. And how we work together with the government to make it a reality is something as a challenge we need to all take out.
No, absolutely. Mahesh, any last thoughts from you?
Again, great participation by the panelists here. I personally think that this entire program, and not only this program, but the overall drive to reach that $120 billion worth of industry is possible with just four things. One is intent, capability, capacity, and finally the processes. I think all four things are there in place right now. Government has already shown their intent by declaring some of the draft policies, and we are going to get benefited with that. There is going to be higher contribution to life sciences and healthcare in the GDP. So obviously the whole industry will get benefited. In terms of capability, we are actually talking to people who are capable in terms of R&D and manufacturing right now, and India has already proven that. In terms of our capability in technology is already known to the entire world. So capability wise, there is no issue. Capacity, especially locally, is definitely there. We have looked at cold chain capability, warehouses, transportation, as well as manufacturing. So they are in the right place at this point in time. So finally, left are only processes. And I personally think that that is one area which definitely requires some improvements. Processes using technology to have better transparency in the system, better access to the patient, and actually tracking right from manufacturing to the administration, the final administration, is something that we definitely need to work upon. And I think we will definitely reach that $120 billion worth of target
No,
that
I
we
think
have.
this is excellent. We are literally in the last minute. Both Raj, any final comments to close out the panel?
Yeah, see, Atmanirbhar Bharat is possible when we have Atma Manthan and Atma Chintan. Manthan means analysis and Chintan means analytical analysis. So we are a patriotic industry. We can do wonders, provided we get fullest support from the government. It is high time we think about the nation and think about the industry and think about the future of the buddies and the new students who are in the colleges and preparing for. And they will really come with a flying color, provided, see, we have the experience and youth is coming along with the energy. When energy and experience is merged, there is an explosion of success. So we need to think about the youth and we need to think about the nation. That's all.
No, excellent. Very good thoughts to close out. I wanted to take this opportunity to thank everybody for spending the time, sharing your very candid perspectives and enabling a very lively discussion on a very important topic. And thanks also for having me moderate this esteemed panel. I really appreciate you for this opportunity. And thank you to the VOH team for organizing this, taking the right initiative and continuing to play such a constructive role in the ecosystem and in furthering the vision that is just so important for the industry as well as for the country. I think on that note, thanks once again. And all of you have a great day, stay safe. And we will, I will wait for the vaccine to come to me in the next few months. But thanks a lot. Appreciate it. Bye-bye. Have a great day.
Thank you. Thank you for tuning in, and welcome to all our viewers, to this very, very exciting panel discussion as part of the larger state health conclave that Voice of Healthcare is hosting. And the topic for today's discussion is acceleration of innovation in healthcare through the very vibrant Indian startup ecosystem. And we have some very, very exciting panelists that I'm very excited to chat to. And I'll do a quick introduction of the panelists as well as myself, and then hand it over to each of the panelists to speak a bit more about their background and their own organization's work. And then we'll get into each specific questions. I think so. Just to kick it off, I'm Karthik Chauhan. I'm a director with Cepheid Diagnostics, which is a leading player for infectious disease molecular diagnostics. It's part of the larger Danaher Group. I'm based in Delhi, and I've been in various roles in healthcare for the last almost 10 years now. And so, I've heard of some of these people that I'm speaking to today, and I've read about them, so I'm very, very excited. As a quick introduction of our panelists, we have Mayur Sardesai, who's founder and partner of Somerset Indus Capital Partners. We have Rajul Garg, who's joining in very early from the US, who's founding and managing partner of Leo Capital. So between Mayur and Rajul, we're hoping to get perspectives of the investor community in terms of health tech and digital health innovations happening in India. And then really from the founders and the startup world, people who are leading and building businesses, we have Raktim Chattopadhyay, who's founder and CEO of Espera Onco Nutrition. We have Neha Sagi, who's founder of Baby Chakra. And we have Mr. Vipin Pathak, who's co-founder and CEO of Care24. So without further ado, I'll hand it over to the panelists to talk a bit more about their background and the work of their organization. So Mayur, over to you.
Thanks, Karthik. So just a little bit of introduction. So I'm one of the founders of Somerset Indus Capital Partners, which is a healthcare-focused private equity fund which invests in sort of the lower tier markets of healthcare. So we do investments across pharma, life sciences, hospitals, diagnostics, medtech, and also nutrition, primary care, and that whole space too. We've been operating for nearly a decade now. This is our second fund which we're investing from. And as my personal background, so I'm an engineer from IIT Bombay, but I spent most of my years, over 25 years, in healthcare, both as an entrepreneur running a pharma business, having run consulting at IMS Health, which is now IQVIA, as well as doing some startups in the area of dental stem cell banking and medical devices before we started the fund. So that's sort of a brief background for my.
Thanks, Mayur. Rajal, over to you.
Thanks, Karthik. Great to be here with everyone, and thank you for inviting me to this show. Very quickly about me, I'm historically a tech entrepreneur who accidentally started investing in health and health tech, over a decade back. But as I started getting into that, I think I got more onto the side of what I would call consumer health, where sort of healthcare solutions meet, the consumers, and ended up making several investments, some of which are, for example, Cygnus Medicare, which is a healthcare chain, 1mg, which is an e-pharma, Life Care, which is another sort of pharmacy, and a bunch of others, Health Assure. We are currently invested into Beto, which is the largest diabetes care program now in the country. So lots of, I think, areas of interest around sort of how healthcare is evolving and extending itself to become a more of a consumer product. And also some of the newer areas now, which are around, just new innovations around medical equipment, technology, greater technology usage in the healthcare space. So those are some of the areas we're looking at and investing into right now.
Super. Thanks a lot, Rajal. I hope you have a nice steaming cup of coffee to keep you going. Raktim, over to you.
Hello, this is Raktim. I'm a first generation entrepreneur. My startup name is Esperer Onco Nutrition. I am the founder and CEO of Esperer Onco Nutrition. Also, I have another foundation, the Esperer Bioresearch, who deals in anti-cancer drug manufacturing and marketing. And Esperer Onco Nutrition is involved into the deep research of cancer nutrition. Almost 2 decades I am into cancer and related industry. All my projects are, accidentally I become an entrepreneur. I had no plan to become an entrepreneur. All my last 5 years before I started my venture, most of my projects got rejected by various promoters of my previous companies, and that has given me a lot of food to go ahead with my own business.
Thanks.
And
Thanks,
by education, I am post-graduation is human physiology and specialized into medical nutrition, and with a thesis paper and liver carcinoma and nutritional intervention. Thank you.
Superb. Thank you, Raktim. Naya, over to you.
Hi, everyone. It's a pleasure to be here. Very quickly, I'm the founder of Baby Chakra. We are one of the largest, most trusted platforms for maternity and child care in India. The whole premise of Baby Chakra is how do you create personalized care protocols for every family that uses us in this very critical journey of pregnancy, postpartum, early child care. It's been an exciting journey. We've recently sort of integrated a very large community of doctors, about 3,000 HCPs onto our platform as well. So now we have a complete care community of not just parents, but also doctors who help families along this very important pathway. In what seems like a very different life before this, as an entrepreneur, I was actually a management consultant. I was at McKinsey, working on some really interesting problems in healthcare. Worked with a bunch of foundations, worked with the government, worked with actually 2 governments across 2 different countries on scaling out maternal and child health interventions. That's been my reason for existence, really.
Thanks. That's really exciting. I know I became a father for a second time, and my wife definitely uses your app a lot. So thank you for doing what you do. Vipin, over to you.
Hey, thanks for giving the time and opportunity.
So I am founder of Care24. What we effectively do is home care services in cities like Mumbai, Delhi, and now we are in Bangalore. What we effectively try to bring is a hospital-like care at home. What we realized, like almost now it has been 6 years. What we realized, and we thought that it is very, very difficult for somebody to go to hospital for smaller things, and hospitals are supposed to be, say, a place for acute surgeries, not exactly, say, a care. And the care is best potentially provided at home. We are bringing that hospital-like quality care at home for a lot of population. Largely, we deal with elder care, though there is a post-surgery and a lot of other rehab care that we do. So currently, we serve about, say, 1,000, 1,500 patients every day between two cities, that is Mumbai and Delhi. And effectively, our idea is that how do we change the overall scene in home care using technology? Yeah.
Thanks. Thank you, Vipin. You and your team must have been very, very busy people in the last year, I'm sure. So,
yeah.
So I think that's a good. Thank you so much. It's clear that we have a very, very diverse panel, and we have some good time. We have 50 minutes to really get through some good discussion. To kick things off, which over the past 2-3 months, every panel I've been on, I think this is the starting question, but this is so much more relevant to the panelists today, right? It's and really to kick it off, it's this past year has been I don't want to talk about it much. I think everybody knows what's been happening, but given where you guys are and the companies you're running and the companies you're investing in, I'd love to hear what were, first off, the challenges, of which I'm sure there were many, but then also the opportunities that came out of it, right? And just to kick it off, I will go to first our founder CEOs and our startup CEOs. And Vipin, I think it's a great place to pick up. So I'll call on you if that's okay. If you want to talk about all the challenges and opportunities.
Yeah. So I think when pandemic hit us, I think none of us were could have been potentially we could not have been prepared for such a thing. So the biggest challenge for us was that we were totally unprepared for a very, very new set of consumer needs, which sort of came very overnight. And all of us were used to, say, a sort of, whether it was online or offline, I think we were set and used to a particular consumer behavior. And I think when the consumer behavior changes overnight, it's not very easy to kind of change the systems and the processes according to it. Create an offering, you don't know delivery mechanism and stuff like that. For us also the same thing happened, right? And we were used to sending somebody at somebody's place for, like you say, day's job, traveling and stuff like that. And overnight the local trains stopped, like the overall the whole ecosystem kind of got stopped in a really big way. So I think the first challenge was that we were unprepared. I think that was the biggest challenge that I would see. But I think from the opportunity perspective, there is a saying in one of the Hindi movies saying that कुछ घटनाएं सोचने के तरीके को बदल देती हैं. So it's like some of the events will actually cause a very, very long term change in the thought process, that how do we think about some of the care delivery systems. And that is what happened. People who were always willing and who were always saying that, okay, let's go to hospital for the smallest of the things. People started calling that, can you send somebody home? I don't want to kind of step out, and especially for the elders where the disease was largely hitting even worse than what it was being for younger generation. People were calling for all sort of needs, like even for a smaller injection to taking a BP, saying that can you make somebody move, even for grocery needs, which we never did. But then they said that we are helpless, can you provide that? And I would say that we did not have enough systems in place for the first 1 month. And what we realized is that if you start thinking about it, and if the system sort of opens up, I think during this was May, June, what we started feeling that if you start looking at your assets, if you start looking at your by assets I mean both manpower as well as the
processes, the technology, you could do a lot. So what we started doing was like COVID care. We started doing live-in care. We started, like, at least there were 5 offerings that we could launch in this particular year, which was just impossible to think, I think, even a year back. So I think that home as a centerpiece for health is something that sort of got established, whether it was telemedicine, whether it was like care delivery at home, whether it was like online yoga sessions, or whether it was like all sort of online, offline. I think at the end of the day, if it could deliver things at home, people were very, very keen that I would like to sort of consume things at home. So that sort of pushed and given a lot of opportunity, a lot of room. So even for say COVID care, like people who say that I am COVID positive, and now what should I do? I don't know how to step out. I'm a lot of challenges. So a lot of plans in terms of how do you manage those 21 days in terms of getting the right care, right set of connections and stuff like that. I think that sort of changed for in the segment that we operate. But I think overall in healthcare, if you see a lot of good changes. So when I'm talking, so whether it is e-pharmacy or whether it is like AI-based diagnostic opportunities, I think everyone sort of started seeing whole healthcare in a very different format, and I think that gives a lot of opportunity and headroom for everyone out here, I would say, for growth. So and I think I'll continue. I've taken a lot of time,
Sure.
so I think I'll continue giving some details around what other opportunities that we look.
Sure. I would pose the same question to Naya, and right, in some ways, you were always, to me, it seems, it was a platform that was always meant to be digital and, faceless in a way. And so how did, and it's also, parenthood is challenging at the best of times. You put parenthood and getting ready for parenthood in the middle of a pandemic, and, that's complications over complications. So I'd love to hear your perspective, Naya.
So, I just think it's an extremely exciting time overall for our ecosystem, for the healthcare ecosystem overall. And I think, frankly, anything in tech and service delivery on tech, right? On digital. I think why I think it's so exciting for healthcare overall is because for the first time, you have influencers like the Prime Minister of India basically saying healthcare is important. We've had these like visible charts on percentage of like GDP spends on healthcare, which have ranged between 0.8, depending on which sort of lineage you belong to in healthcare, to like 1.25, and now finally it's like doubled at least to like about 2.5 or 3% of spends. So I think you finally have evangelists, influencers at a position of power to really champion the cause of healthcare overall, and hence the entire sort of shift we see, the conversation to healthcare. I think this pandemic has absolutely accelerated. Right now, I think two very specific challenges and opportunities that we saw at Baby Chakra. Right. One was, we started this program. It was a pilot program. We were working with offline clinics, and we were saying, with all the HCPs that were working with us, and we were saying, how do we help bolster you and sort of empower you to provide like a set of tertiary services? So, if you're a gynac, how can you provide, like, how can Baby Chakra sort of be your care partner with your patient and, provide like lactation consulting or prenatal care, et cetera, right? And that offline, pilot was actually scaling really well. And then, of course, COVID hit. So I think that was a big challenge for us. But I think the opportunity that came out as a result was, all the time that the last year that we spent in actually onboarding doctors, the amount of inbound referrals that we saw was just exponential, right? So if I think about 3,000 HCPs, I would say about almost 60% of them have been onboarded in the last year itself, right? Because for the first time, doctors, right, who've typically been, a little cautious of anything digital, have taken a front foot and said, you know what, we have the medical council, the telemedicine guidelines now support us. You have to think about patient engagement, patient retention, digital brand building online, right? What are the platforms that we are best suited and have the best cohorts for us to really engage deeply on, right? So I think while we moved away, the challenge was we couldn't do as much of the offline clinic, in the clinic touch points we'd like to. We've actually sort of had very, very robust on Baby Chakra app website touch points with our created patient engagement journey there, right? I think the second piece is, and that's again like a comment on the entire sort of space, right? Baby Chakra's recently launched products as well, and there was a part of our strategy which was how do we sort of leverage offline touch points to sort of disseminate these products and talk about these products. if you talk to the top pharma companies in India, they will say that sales over the last year have tanked of antibiotics, right? So because the clinics are not operating. So like, who are we to really try and sort of make that work? But I think the opportunity that happened as a result, Karthik, is that commerce, people are now discovering products not in the doctor's chambers. They're discovering products online. They're discovering products on social media more and more. They're making product decisions not in the nearby chemist necessarily, but on e-commerce stores, right? So again, I think the digital acceleration on product discovery, product consideration, on product conversion is, I think the time is here, the time is now. So I think these are the broad sort of highest level opportunities and challenges we saw at Baby Chakra. Happy to talk more.
No, this is great, and it really, I would like to bring in Rajul, because something you said now really kind of stuck with me, and Rajul in his introductory note talked about consumerization of health, right? Yeah. And so people discovering product services not necessarily in the doctor's clinic, but through self-research online or such. And so, Rajul, I'd love to get your perspective from from an investor's perspective, really, around anything more you've seen, new ideas come up, new collaborations, or anything that's really exciting that's come by your desk in the last year.
Sure, Karthik. So first of all, I'm conscious of all the sort of work that sort of all the doctors and all the healthcare workers put in over the last year. I think it's just been a heroic effort, and I know life hasn't been easy. And also the infrastructure and hospitals and stuff like that. On the other hand, the digital guys honestly have had it good, and I think it's true worldwide. Even if you look at sectors like education and healthcare, they're primarily services sectors, right, where sort of they've been dependent on doctors and teachers. And I think both have seen transformation for sure in what you said, just getting the whole system closer to the consumer, because there is a information arbitrage, right, that unless you go to a doctor, they diagnose you, and there's a certain process of getting that done. And obviously, since that couldn't happen, people were forced to do more stuff online, which has been great for just innovation and digital outreach, massification, and all that stuff, right? So I think if the digital side of healthcare, it's certainly been a good time, to just get out there and get more adopted. Specifically, I think there's some things which are very apparent and some things which are more in the works. So some things which are apparent is what, like Naya said, more doctors coming online, consumers doing most, like in Beto in our diabetes care, like people are much more willing to self-care for diabetes versus going to like a doctor, right? So that percentage of people, who are doing stuff themselves, buying a glucometer, testing themselves, self-medicating, has gone up significantly compared to, let's say, a couple of years back where, they would generally go to a doctor much more often, for example. Doctors themselves have come online much more in consulting with these patients, and these are the obvious ones. But I think some of the non-obvious ones are also things around just insurance. I think health insurance, if you see, which is just a great enabler for the overall healthcare ecosystem, is also coming of age and becoming more and more consumerized. I think the innovation in products, like earlier, for example, there were just not that many products that you could buy with diabetes coverage. Now you can. There's innovation around coverage, around networks, around distribution, around very specific productization, which has also, I think, gotten kickstarted over the last 18 months. And it's just a slow rollout, but we'll see a lot more of that, I think, in the next 2 or 3 years, which will also act as a force enabler to the whole ecosystem. So I think that's another angle which is kind of coming in an interesting way.
No, thanks, Rajul, for those examples, and I think it's a really good segue into our next question. And something that these terms, when I hear this, I think they're talked about loosely, but again, I think to the set of panelists we have here, I'm sure you're using some of these tools and incorporating these technologies in your work or investments. And so really the question I had was, if you could talk about some of the new transformational innovations, it could be in artificial intelligence, machine learning, robotics, Internet of Things, specifically in your industry or, even in your own organization, right? So with that, I do want to go to Mayur. He's been listening patiently. Again, from an investor point of view, you're very well clued into the system. Have you seen more of that happen in the last 2-3 years? And of course, we talk about that a lot more. A lot of that narrative is coming from the West, from developed countries. And sometimes I think it kind of generalizes where India is at a slightly different level, and our complications are unique, right? And so I'd love to hear your perspective on, particularly for our country and our region. Do you see these innovations being incorporated more?
Yeah, so I think if you look at healthcare, you need to sort of break it down into sort of various segments of what you're working on, right? You've got the whole primary care segment, which is sort of moving, like Raju and Neha said. I mean, it's moving towards consumerization, and there you see a lot more digital sort of activity happening, whether it is in diagnostics, whether it is in consulting, whether it is e-pharmacies, all that. And I think that's a great space, because that you really see expansion of the healthcare market, because primary care actually drives healthcare in most countries. I think that was dependent on three areas, right? One was internet penetration, doctor adoption, and the payer mechanism. I think internet penetration got sorted out when Geo, etc., came out, and I think that part was taken care of. I think one of the biggest challenges was was doctor adoption, and I think COVID has basically transformed that. And I think in the long run, that's the sort of game changer which you needed in this space, because especially in the Indian context, no doctor really bothered about digitization and digital care, because he had 200 patients sitting outside his door. When was he going to really get time? Today, when they really found out that they cannot access patients, they immediately changed, and that has been a significant change which has happened in the last year. I think the third play which Rajul mentioned, I think, is the whole insurance and the payer mechanism, because especially on the primary care side, unless you have OPD plans, etc., in place, healthcare is a negative need, so nobody is going to go and do a checkup unless required, unless you've got a payer mechanism in place. And I think we've seen the payer mechanism grow in the IPD space in sort of hospitalization. But I think there is a crying need for lots of innovative products to be developed in the OPD space to really build this whole ecosystem. I think two legs are sort of covered. The third leg is still sort of getting there. But it's an interesting time, because it will definitely expand the market in a big way. I think the other part which we focus on, and I'll run you through one of our companies which has done that, but is the whole using digital to create access into markets, like in the lower tier markets where the specialists are not available. How do you really reach specialists there? And I think now there are enough technologies and sort of business models created around them. So like teleradiology was the first one out, but now you see telecardiology out there, you see tele-ICO platforms which are being built out. One of our portfolio companies in Rajasthan is working on an entire tele-ICO model. But telepathology is something which we see coming out of age in a big way, which will allow for highly specialized pathology tests to be done directly through digital sort of plays, where it'll work very similar to what teleradiology does. And we've seen teleradiology extremely well. We've got one platform called Krishna Diagnostics. It's India's largest PPP platform. It's built entirely across. It's the largest rollout of CT MRI scans in the country. It's got the largest teleradiology network, which runs out of Pune. It does 5 million scans a year on the teleradiology platform without having doctors sitting at government hospitals and government sort of centers in remote parts of the country. And I think it is proved very clearly that you can use technology to sort of drive that. And I think you will see more and more of that happening, because in India, the real crying need for healthcare and access to healthcare is the lower tier markets. And can you really reach that? And the only way you can reach that is through technology. Government is trying a lot of payer mechanisms like Ayushman Bharat, PPPs, which are in place. But unless technology covers the gap of the lack of doctors, I think that's very difficult to meet up. And I think that whole play is another transformation which we are seeing coming of age, and various business models are being, sustainable business models are being built around it. And I think that is another thing which is happening. I think the other third piece is the real, the medical devices in health tech, your diagnostic products in health tech. I think that piece is still sort of in India is still starting off. You see a lot of innovation there, but a lot of innovation doesn't get commercialized to the next level. And I think that the biggest challenge there is the lack of funding. You see government agencies like BIRAC, etc., do the initial level of funding, but then the next level is never available. And that you see in the markets, you will see a whole ecosystem built to take products to the next level. I think that is a big gap which needs to be addressed to take real Indian innovation, because Indian innovation just doesn't work in India; it works across emerging markets. And I think that's the sort of area which we need to sort of work on.
Thanks, Mayur. That really struck with me. I think the doctor adoption piece is something that a couple of you have mentioned, right? And in my previous life, when I used to work in public health, getting doctors to listen, and purely because they just have too many patients, right? Not for any other reason. I think in India, it's all a numbers game, right? And so I think I'd love to maybe circle back on that. I do want to go to Raktim, and he's I know he's in a very exciting space, around personalized sort of medicine. I'd love to hear whether Raktim, you've used any of these tools to really in your own business and offerings.
Oh, of course, especially the artificial intelligence we are looking at very aggressively. I would say this way now: innovation and creativity, these two words are become very, very relevant in this pandemic, because having said innovation, being innovative needs a space of thinking, and I think this pandemic has given us a lot of space to think. And when it comes to the creativity, when we don't have any options other than doing things differently, that germinates the creativity part. And both the things has happened very successfully, I think, in this pandemic days. And my company is not out of it. The conceptualization of the company, when the investor came, and to tell you, in the March 2020, company got infused. Okay, so and then lockdown started. Okay, so I was in a very critical moment when I know statistics says that 70%, 76% of investors backed up on those days in last year because of the pandemic, and I was one of the fortunate where my investor did not go back, and it became a responsibility and accountability for Aspera Nutrition to be on the strategic intent, and to delivering the strategic intent, working towards strategic intent, in spite of sudden lockdown, which nobody thought in this way. In the first couple of months, everybody was thinking that things will be better in 2 months or 1 month, and it went on. Still, it is going on. So in that case, since we are as a strategic intent, we had a plan of incorporating make the nutrition more personalized, and using the artificial intelligence in terms of making the nutrition personalized, especially in the context of cancer nutrition. So in that context, I would say that we have not gone back. Rather, we got a lot of time to get the real data, to talk to the people virtually, analyze a lot of data virtually, and there are a lot of time was there. So we could successfully progress towards the timeline of implementing especially the artificial intelligence in some of the other tech areas where strategically we decided. So in a nutshell, I would say that cancer is always a multidisciplinary approach, and nutrition is always been understood as a supportive care. And in India, supportive care is something which has the last options. So what we are trying to do at this juncture, which makes the job much difficult and different too, is bringing the nutritional interventions in cancer therapy as complementary therapy rather than supportive therapy. So there, the technology plays a big role. Understanding, suppose a patient who is taking a chemotherapy, and WHO says that 30% of cancer-related deaths are happening because of the malnutrition. So this is a generalized data. When it comes to the India, the numbers is much bigger because the malnutrition status of India is very high, and malnutrition is not poor nutrition; it is also overnutrition. So if you look at the lifestyle diseases, it's more of because of the overnutrition or wrong nutrition. So it's what to eat and when to eat. It's very, very important than whether we are all talking about that, whether we have the food, right, adequate food or not. That definitely that's a concern. But when it comes to the cancer, like critical diseases, it's what to eat. Very important. Lastly, I would say that the digital reach which has increased because of this pandemic, which has given a lot of boost in terms of patient educations, because patients also had to go for the self educations, because someone was telling in the panelists rightly that decisions are not being taken abruptly in the clinic. Rather, it is taken by themselves, patients. So patient education, which has been a major focus from the government side, that has been accelerated in a greater extent in this pandemic, and technology has helped. So accessibility and accessibility through the technology, I think that has been added in a great way. That's how I would say.
Thanks, Raktim. That's a really interesting perspective. I do want to go back to something Mayur said, right? And it was around funding and where does the funding come from to take innovations to scale, right? And I think you can make the argument, and I think Rajul said that earlier, that in terms of funding, access to capital, access to ideas, EdTech and healthcare, they've really sort of largely they've benefited out of it, right? In the last 2 years or in the last year and a half, right? So my question is, whom does that sort of responsibility to fund innovations and take to scale fall on? Is that partly the government? Is that the investment community that Mayur and Rajul are part of, or is it another third kind of capital? So Rajul, maybe I'll turn to you, and I know Mayur raised this, but I'll go to you, and then maybe I'll circle back to Vipin to get his perspective on where he goes and seeks funding to go to scale.
Karthik, like you said, India is a numbers game, and like Mayur said, India, and I think rightly so, most of the investment still largely goes into distribution of products, right? Access, reaching the next billion, next 200 million people across sectors, whether it's education, healthcare, e-commerce, content. You look at, because I think we have like a whole population which is coming online and accessing products for the first time. I think when you talk about original innovation, AI, robotics, like we do see green shoots. Like we see, for example, companies doing radiology products, right, which are using AI to scan, an X-ray and coming up with really good insights, which radiologists may not come up with on their own. But I think the adoption of those products, the investment that is required, is actually not that easy to get. I think it all is a part of an ecosystem. The adoption by the hospitals and the radiologists themselves is low. Their paying capacity is low. Insurance doesn't pay for it. When you put it all together, it's very hard to see very large businesses being built, and that keeps the venture ecosystem away a little bit. So some of these companies are going early on to global markets, Middle East, Southeast Asia, even US, to expand their sort of market size and what they're catering to, and seeing somewhat success. It's early days. I saw this in software. Like if you look at IT services, Infosys, Wipro, TCSs of the world, we did services for a very long time. And I think only in the last 7, 8, 10 years, we see now original software products coming out of India, like Freshworks and Dhruva and so many others, right? I think we saw this in China. China, people kept on talking about as a manufacturing hub, for a very long time. And actually China is now an original manufacturer of drugs and tech, in a very big way. And this happened very quickly, really in the last 5 years, after like a lull of maybe 15, it was kind of manufacturing, and then a lot of it started happening last 5 years. I think with COVID, we see, like Serum Institute and so many manufacturers have come to the fore, and we also see indigenous vaccine now, right? We have a real indigenous vaccine just created here which is being distributed in a vast way. I think these are all good signs. I think if we fast forward this few more years, I think it's more a matter of time, as India will become more and more an original manufacturer of, drugs, technology, equipment, stuff like that. I think it's just inevitable, but just a matter of time. I think no one person has a responsibility for it. I think, look, VCs are the worst, right? VCs are basically pure opportunists and sort of only come in when it's all lined up, right, and teed up. So they, will not carry this burden. I think government has to carry a little bit more earlier on. I think the strategic, impact investors, strategics, they have to carry a little bit more. But I think it's really the ecosystem, which kind of together comes together, over a period of time, which comprises of entrepreneurs, ideas, investors, government, stakeholders. They all keep on getting matured, and over a period of time, it looks to be fresh.
Okay, thanks, Rajul. The comment on the VC, you said it for the record. Huh? So, but I before we move on to the next question, I do want to go to Vipin, who's been listening very patiently and really get a perspective from the other side, right? And in terms of, I'm sure he had to go to investors to raise capital. But Vipin, what do you see the role of government philanthropists? I think that's the other piece we didn't talk about. And then, of course, venture capitalists and private equity. How do you see their roles?
Yeah, so from my standpoint, I think both. I think when you ask the onus and where it should kind of fall back, I think it all starts with entrepreneurs first. My sense is that we are the people who see things. Not exactly we, as in I don't want to say it like in that proud and that kind of fashion, but I'm saying that we are the people who are supposed to kind of see an opportunity and say, then go back to different sort of people. So whether it is an investor or government, I would say that how do we find an opportunity? How do we sort of scale it up and things like that? That is squarely on us. From a government perspective, I think that in India, in particular, I think the spend on healthcare innovation has been like really low. So there's no infrastructure. So today, if you see, I'll just give an parallel of that. Like say, if you take fintech, as soon as there is a UPI, you see that a whole lot of fintech players have come with very interesting offerings, with very interesting stuff that they have been doing. Now that is something that we have been lacking in health. So today, if you want to access health data, if you want to kind of create any model around it, if you don't want to, so I'm saying that providing that infrastructure is the foremost thing that government has to actually do. Like today, there is no right definition of even an electronic medical record that exists for India. So I would say that more than the funding itself and the grant itself, I would say that creating that infrastructure on top of which all of us, like all the health entrepreneurs, they should be able to build something. And I think NSDM is a right step in that direction. But I would say that there is a long way to go there. That's my sense.
Thanks, Vipin. I think that's a really telling point, right? Around, more than the funding, the supporting infrastructure, right? And I think maybe you mentioned NDHM in the end. And so if we have time, we'll circle back to that. And I'd love to ask more questions on that. I do want to, just before we sort of move on, I do want to go back to Naya. And she mentioned, I think in her introduction, she mentioned all the new innovations, the new business models that have come up. So it's a little harking back to the earlier question that I asked, but maybe if you can talk about, what are some of those things that will stay? We're still very much in the middle of the pandemic. We're in the middle of the second wave now. But what stays with you? What stays with Baby Chakra that you'll keep doing when things hopefully return back to normal at some point?
Sure. So, Karthik, I think two things in particular. The first piece around the doctor's piece, I think every panelist, all of us have basically talked about the digitization of doctors at some level, right? Which is such a, I think, tectonic shift from where we were a couple of years back. And I think that piece is something we continue to invest on more and more. And, one thing we've sort of seen is that even for, and I think especially in the whole pregnancy and the postnatal period, right? I mean, the more you sort of limit the touch points, in-clinic touch points, the better it is for the overall ecosystem to sort of reduce the spread of the like to reduce infection rates overall, right? So that's something we continue to build on, and we built out some very, I think, pretty helpful, I think, patient engagement and patient retention and patient sort of callback journeys on Baby Chakra, right? Using the doctors, the HCPs that we have partnerships with. We've also actually started working with pharma companies, and we're actually bringing in their doctor bases onto our platform. So this whole sort of period of like, I think Rajul talked about sort of, one of the biggest costs that you have as a company, as a startup, is actually going to market, right? And I think HCP is a very, very major part of the cost, right? Acquiring HCP. So I think the partnerships, the inbound referrals, etc., have really helped us sort of reduce those costs substantially. I think the second thing that I'm going to sort of keep pushing on as part of the company, and I sort of see a lot of very interesting models of that now being built in the US, are where we are very specifically focused on a life stage, right, which is an extremely important life stage, which is prenatal, postnatal, early childhood care, right? And therefore there, I think the intent is that, and I think Rajul talked about this, right? You can either go to scale on like numbers and you sort of just completely open out your user base and you talk about the numbers game with funding and sort of to get to, growth as a company, or you can sort of cross-sell, upsell a bunch of services and products that same demographic and do it really well. Right. And I think that's something that we believe in Baby Chakra. We really need to do we need to sort of nail that. Right. So while we sort of, earlier we were building out communities of parents and communities of doctors. And now we're actually working with these communities of parents and doctors to actually create bundles of services and products for them, which are relevant for them at different milestones in their journey, right, of pregnancy and parenting. And therefore, that one family who joins us will get a full stack service approach from Baby Chakra. And, that is really the mission that we have. And that's the mission we've evolved to. And, we sort of see this play out, I think, extensively. I mean, you just, you hear of all these models, like right from Row to like, a bunch of, like a lot of these models in the US now, which actually focus on these sort of full stack approaches of services and products, so digitally enabled services and physically enabled products, right, to really help solve problems. And I think that really resonates with us as a company as well, and something we definitely intend to stick to.
Okay, thanks. No, those are really interesting examples. I do want to change gears, right? And I think this is something that always comes up as, I wouldn't say it's the elephant in the room, but I think people talk about it a lot. There are a lot of concerns on it, but I don't necessarily know whether the ecosystem has nailed it, right? And it's really around sort of data interoperability, patient data confidentiality, and the fact that we're all, I think, largely moving to this digital space. There's a lot more data. Yes, you can do a lot of fascinating things with it, but then it's also, liable to a lot more sort of risks, right? That's how I see it. And so I want to go to again, maybe Mayur first, to get his perspective on, how do they screen for these things? How do they maybe make sure that, that's being prioritized and the correct protocols are being followed? And then maybe go to Raktim and even Rajul. So Mayur, over to you. I think this is really something that everybody talks about. So I'd love to hear your thoughts.
So I think data usage, like you said, is still a very gray area. What the privacy of data, how it's being used in India. I think these are still things which people are sort of maneuvering around. You really don't know what's completely right and kosher, and how would it work. So I think it's still early days. People are maneuvering around things. I think there is a definite intent to use data to improve business models, to improve service levels, to improve product quality, all that. And I think nobody doubts the fact that data can sort of work well. I come from a background of IMS Health, so I know how retail data was used and built up. So we've seen that. I think that will drive things in healthcare, but I think data should also be used to reduce costs in the healthcare system. And I think that will happen predominantly because of two things. One is the payers sort of demand that data gets used interoperably, So healthcare insurers or the government, Ayushman Bharat, etc., will say, this is the data which you should use. I think the digital health ID, which they are trying to put together under NDHM, I think that is a complete sort of move in that direction. And I think that will help, because finally there is only so much of a healthcare budget available, right? A finite healthcare budget, or you have to use it efficiently. And the only way you can use it efficiently is by sort of making sure that healthcare needs are accessed, but as sort of efficiently as possible. So I think that's what is going to drive the healthcare system in India. And if you see in the Western world, it is that it's the reimbursers, etc., who basically drive that whole model. And people fall in line, because if you need to sort of get reimbursement, you have to get and do all these things. So I think that system is coming to India, and it's good to see that that system is coming much faster than what we had envisaged at one point. I think if you talk 5 years back, healthcare insurance of any kind was never factored in any growth model to look at. I think that thing has changed completely. There is a definite component of that in everybody's sort of radar. But then yes, you need to learn how to work with information and data to basically make it work well. So that's our take on it.
Raktim, I do wanna pull you in actually, and I wonder if these are challenges you face in your business, right? In terms of patient confidentiality, specific data that can be fairly sensitive, and how do you mitigate against making sure that data is not used inappropriately? Raktim, I think you're on mute.
Sorry, I'm extremely sorry. So this is something is very, very relevant, and I have a hands-on challenges on in my company here. So data is important for any startup, especially for the startup like us, where we are into clinical stage and conceptual market, where we are trying to do something different. In those areas like us, data plays a big role. So I would see it in this three phases. I have seen the challenges. One is that first is the availability of the data, right data. So identifying the right data relevant to my business is very, very key, which my team has spent a lot of, and initially in a pre-company incorporation time, there are a lot of time spent on that. Second is affordability of data. So affordability is something related to the how do I prioritize the data, importance of data in my business, in my P&L where data exists. So I feel that now when you are bringing in investors, aspirant investors, and you have a very aspirant business model ahead, there is a chance that you overlook the importance of the data, and you hardly find in a place in your P&L the data where it can be setting. So there are a lot of internal challenges I face to put the data takes a good chunk of P&L in that, and for a long run, this has got a value. So that's how the affordability part has been taken care. Now that while using the data, the data creates data. So when you buy a data and get a data and using the data, you have by default you generate an accountability by yourself that you have to create a second layer of data which you'll be using for next generations. So there also company needs to structure it rightly. So how, when you are using the data, the new data when it is coming, how you are going to capture and how you are going to keep it for the record. So I think we did it. We are doing in a very passionately. I'll tell you that in this pandemic, even recently, the second round of fundraising has completed by a company, and we'll be going for the third round again. So milestones has been achieved by the company much before that it has been projected, and data has got a role more than 70% in this achievement. So I see that there is a lot of behavioral challenges we have, and I have faced in adapting the data, practicing the data, and creating the data out of data. So this is how I would say.
Thanks, Raktim. I'm looking at the time, and we'll go to what will probably be our closing question. But before that, I did want to. I think what you said around where does data fit in my P&L? How do I monetize it effectively, right? And that's something that I think a lot of companies are struggling with. Maybe companies in the US have figured this out a bit more than we have. I say this as I wear a watch where I willfully sign up, give away everything to Apple, and they know my location, they know my ECG, they know I just got told it can measure oxygen levels and things. So, Rajul, maybe if you can come in and speak about some companies or some innovations that that have done this well. Maybe in India, that's even better, or something that the ecosystem can aspire to as they sort of mature a bit more.
See, I think data is very closely linked to invention, clinical research, new drug creation, equipment, and stuff like that. And I think because we're still new in that ecosystem, right? I think some of the work that Raktim is doing and others is still, I would imagine, quite cutting edge. And I think that's where you see more and more data. Like, we talked about radiology. Data is very important. The more you can train the model with data, it'll produce better results. So, for you to produce an accurate X-ray using AI, you need, millions of, you need to process millions of models first so that it can learn from them and, it can do better. So I think it's early days. I think monetizing data in India is still challenging. In my view, I think in the P&L, it doesn't really show up as it shows up as an intangible asset still, not really like a real tangible asset. But I think it will change, over a period of time. And I also think, given the size of our country, from a policy perspective, it's a huge strategic advantage. I think there is still lack of data in many spheres like cancer. There may be diseases just specific to India or to Asian diaspora, and there's not enough research, on that in the West, just because the disease is not as prevalent here. So I think it's a great opportunity if I were to look at policymaker to leverage the data that we can produce in India, to use as an input both in India and for global research. And I would love to see more happen there. That's it.
Thanks, Rajul. Ned, did you want to come in? I'm sorry, I missed if you wanted to add something.
No, I mean, I just want to sort of quickly just give like a single point, actually. I mean, I fully agree. I think Raktim made an excellent point in terms of how does data fit into and we've sort of thought about this a fair bit as well. And I think, when I look at, as entrepreneurs, when you look at the role of data, right? And I think very, very tactically, there's a revenue enhancement that data can do, or a cost cutting that data can do, right? So, I mean, at the very highest level, right? So, I mean, one thing that we're seeing a lot more experimentation on, and we are also trying a few experiments there, is in terms of how do you triage and how do you sort of save costs? Because see, the revenue augmentation piece is still an early, there are some cross-selling, upselling of products and services based on sort of personalized care that we are sort of trying to do, but those are early days, right? But I think in terms of the cost cutting, I think that's a clearer path because, we're already doing it, right? We're already sort of using, we've been using level 1, level 2 sort of chatbots, but like you're moving to like sort of, level 3 AI already in terms of your, conversational interfaces, sort of triage some of the issues out that people on your platform face today and lead them to the right sort of solutions faster, right? You're sort of cutting down on call centers, you're cutting down on sort of support teams and community teams who are like physical people and sort of, trying to sort of triage the right way. And then I think linked to that is how do you sort of also help these same people, the same families who use us for like sort of, service requests or product requests, how do they get access to their sort of, healthcare or their immediate sort of support services requests faster, right? How do they get access to the right practitioner faster? So I think there is definitely a cost cutting that is an immediate sort of benefit of the data. The only question I do have still, Karthik, and I think again Rajul talked about it, is a lot of underrepresented communities in this entire sort of AI effort, right? I mean, women is an especially underrepresented one, and Indian women especially so. So I think that's where I think, platforms like us and a lot of other platforms operating in India, we need to play a lot more responsible role and a lot more, I think, active role in ensuring that these data sets are collected responsibly and at scale, at a certain scale, so we can represent their voices and their interest in the way this data is actually collected, but also more importantly, interpreted and applied back, right?
Yeah.
So I think that's a big, I think, one piece I'd sort of lay out.
Yeah, no, thanks. That's you really hit the nail on the head. And just before this panel discussion, I was reading something which was really a critique of our digitization in health, right? And it was around what happens to all the digital have-nots, right? And how do they get included in all this progress? And I don't think it's an easy answer to that one, but you make a really good point, I think, and including women, of course, in our data sets. I'm looking at the time, and maybe we have time for our last question. And I think this is a good fitting way to close this, because it's really around, how can startup accelerators, right, or this whole ecosystem with investors and founder CEOs, mentors, become more effective in really catalyzing innovations and bringing things to scale. So again, not a totally unique question. We've talked about this theme through the past 1 hour, but maybe how we'll approach this is I'll go to each one of you, and maybe if I could get your comments for a minute or two, and then I'll move on to the next one. I think that'll be a good way to close as well. So it doesn't necessarily have to be about startup accelerators, but just how you see maybe your role and the role of others playing into this system. I think it is a very vibrant one. I think it'll continue to be vibrant going forward. So Mayur, we'll kick it off to you, and then I'll go to each one of you for a minute or two.
Sure. So I think at the startup accelerator level, I think especially in healthcare, one of the areas which they need to focus on, and I'm involved actually with the ID Bombay accelerators and incubators like Sign and Betic. And what we see constantly is that healthcare has one differentiator as compared to a lot of other areas, right? Is that there is a regulatory issue, there's a clinical trials issue, etc. A lot of innovators don't understand that aspect, and also I think there's a flip side to it, and due to which the time taken, a gestation period for a startup to sort of build scale is longer. So even in investors take a different view on that. So like you said, like Rajul said, ed tech you could go in faster, but probably health tech it would be slower to get to. And that is something which innovators need to understand, that in healthcare you need to be a little bit more patient to build scale. I think both sides of the coin need to understand that. It's not something which would go the same way as many other sectors, because there is that whole issue of regulation and trials in the system. I think the other thing is, in the Indian context, is like we discussed, there is a gap, the funding gap, right? Before you reach the VCs and the PEs, and where the government sort of ends. How do you fill that gap up? And there are probably two ways. One is, look at family offices and those kinds of, that ecosystem is now slowly maturing in India, and there is a lot of interest on healthcare, either from healthcare family offices or non-healthcare, because they believe that this is makes a social impact. I think that's the ecosystem that needs to be developed by the accelerators, etc. But I think also something which Naya pointed out, right? Everybody does not need to build a commercial platform. I think that needs to be understood in India very clearly. There are some people who build a commercial platform, others need to piggyback off that to build out. And that means that there needs to be a very mature system of partnership or licensing, etc. I think that is another area which needs to be really addressed, because if that is well understood, and unfortunately I know it's not easy, because in India most people believe a partnership is 90% is mine. So, but I think that if it is addressed, a lot of this in between which we face to scale up is something which will get addressed well. So I tend to call it investment in kind, where larger platforms should offer, and we do that. We've got medtech platforms which will work with initial innovators just to prove a proof of concept. If they do that well, maybe they'll take a stake in it at some point as they scale up, or they will roll it into their platform. But I think those kind of partnerships are important for accelerators, etc., to develop, because that is the real gap which we are facing in the industry right now.
Thanks, thank you, Mayur. Vipin, I don't know if you're still on. I'd love to get your thoughts as well. Okay. Maybe we'll circle back to Vipin at the end. Rajul, again, I think maybe it's fitting that we go to you after Mayur. So would love to hear your thoughts as well.
Sure. Look, I think healthcare as a space, I would say, actually is really well suited for accelerators, incubators. Just because, think of it this way, like if you think of, again, software and other areas, a lot of entrepreneurs come from tech schools and MBA schools and things like that, because, the domain knowledge, maybe you don't need that much domain knowledge and you acquire that, right? But health is a very domain-centric field. So you see people coming from the domain, doctors, practitioners, becoming entrepreneurs. And I do think it's a new thing for them. Whether if you're a non-medico doing healthcare startup, then, you need healthcare support. If you're coming from healthcare, maybe you need commercial support, and we see this in entrepreneurs. And I think accelerators and incubators can add that. It's also, you need more patience, you need more connections. There's a regulatory overhang. There's a bunch of stuff. So I do think it's a great way to get companies started. We need more of them. I don't see enough of them, honestly. I'm trying to think, like in the US, I can think of Startup Health, but when I'm trying to think of India, I'm trying to think which incubator accelerator is there, and there might be a few, and I'm just, apologize for my lack of awareness, but we haven't seen enough coming at us as we see, from incubators or accelerators. I also would love to see them more specialized, just because healthcare is so wide, right? I mean, you can choose certain diseases, you can be more on the equipment side, you can be more on the distribution side, but there's so much, the area itself is so wide, or biopharma side, that you can, I think, pick your battles and just be very specialized in a couple of areas. And I think that will also allow you to add much more value. But I do think it's very, it's very fertile for accelerators, incubators to succeed versus the general purpose accelerators, if I compare it to that. So.
Thanks, Rajul. That point on the specialized one or going niche is a good one. And maybe that's a good way to bring in Raktim, right? Because in a lot of ways, your focus is singularly on oncology, right? And so maybe from that perspective, getting your thoughts would be helpful.
Well, there are two things I would like to mention here. First, being a first-generation entrepreneur, what I've learned is that the one and only responsibility and accountability of an entrepreneur should be, when you're raising the money first time, how fast you can return the money to the investors, and that will tell whether you are successful or not. So
I don't think it's exactly like that, Raktim, but I think your first responsibility should be towards your customers.
I can see it brought a smile to Mayur's face.
In fact, that builds a lot of confidence as a person, to me, as well as to the investors and you. That is another way you can attract many other investors also for your good projects. Secondly, is that before I start the business and after that start the business, there is two entirely different world. There are a lot of things which I intended, it does not happen the way I want. Okay, the way I want it, and that creates a lot of unhappiness, disappointment, and that has a potential to destroy your original intent of the business. So I preferred not to get distracted, at least for first 1,000 days of starting the business, irrespective to whatever the challenges came in the way. That doesn't effectively means that I being rigid, but yes, rigid on the belief that business has started with. So that gives a lot of confidence to the team that is working for your project. So I have seen that when the challenges came and the team look up to me, and when I shown that confidence back to them, and things they could take it in the next delivery. So not getting distracted because of the disappointment or because of some low-hanging fruits is the key, I think, I would say. So these are the two things very categorically I would like to know.
Thanks for that candor, Raktim. Now I'll call on you. It's the hard job of going last and almost summing up the discussion for us, but makes my job easier. So I'll go to you, and if Vipin is able to join back in, then maybe we'll close with him. But over to you.
So do you want me to sum up the discussion, or do you want me to give my comments?
In 1 minute. Whatever you do in 1 minute. No, I'm kidding. Please, the floor is yours.
Okay, no, I want to talk a little bit about the accelerator piece. I think it's an important piece because I think Mayur and Rajan made very important points. There is a missing big gap. It's almost a chasm actually between like a company that gets funded at seed stage and then a company that needs time to grow, because fundamentally, inherently, you need enough data, you need enough sort of volume, and therefore enough capital to get to the other end, right? I think just a thought there. While of course we've been part of the Google Global Accelerator cohort in the Valley, and we were selected there because the healthcare teams did want to work with us and sort of see how we could build things together. I feel that in India that's still missing, and I think in India there's definitely a space for a lot of the the pharma companies as well as sort of med devices companies to play a more active role. Mayur did talk about family funds. I know the Apollo family, for instance, is very actively involved. The Poonawalas are, doing sort of investing in specific sort of initiatives. But I think that needs to be a much more concerted effort. The way you see sort of a Target retail accelerator, right? Why don't you have something similar for healthcare? So I think that's a broader question that we still need to answer as an ecosystem.
No, super. No, that's great. It's really good getting all these perspectives. I think, I think in terms of sort of summing up. First off, thank you for your time. I think I had learned a lot, both as part of talking to you all and then researching about you all before the panel session. So, but I do want to say this, and before I got on this call, I just happened to see, I'm in Mukteshwar, so I'm somewhat isolated from the news that's happening. But I did pick up the newspaper, and it said 55,000 cases again. So I was a bit down and out. But having spoken to you all, right? You guys are extremely bullish for all the right reasons, right? This is a very vibrant space. I think, on paper there is absolutely no reason why we can't be the capital of digital health innovation in India. We have the best clinicians, we have the best engineers, and so I think personally it's a good way to end, because I can tell that all five of our panelists have been very, very positive. Of course, there are some clear things that the government needs to work on, maybe the startup founders themselves need to work on, and then of course there is the role of the investment community, which is not just the VCs that were represented on this panel, right? I think that's the good one to call out. But unless anybody has any closing remarks, I think we can close the panel discussion. Thank you all for taking time. I know it's busy schedules for you all. Stay safe, and hopefully we'll get to do this again, and maybe in person over a cup of coffee or something. So that'll be really nice.
Thanks, Karthik.
Thank you.
Thank you all. Thank you. Thanks.